Yeah, you can see the screen there, which tells you about the program for the day. We are starting with the welcome address, followed by Madam's inaugural address. We will be having a pre-test very soon after Madam completes her speech. Then we'll go on for an introduction of the revised curriculum. After that, it is going to be a highlight of the program structure with credit points and how these credits are being distributed across the semesters and the hours for each course. We will also have a review of courses from 1 to 8 semesters that has been placed in the BSc nursing curriculum. Again, we are going to tell you about the mandatory and elective modules and how to go about with the implementation of these modules. You all know that a new grading system has come, which incorporates the semester grade points and the course grade points. So this has to be taken into consideration, the cumulative grade points. All these important aspects will be presented today. You will also have a glimpse of the formative and summative assessment, the changes that has come in the system of evaluation for the students. And finally, we will have the implementation plan for both the theory and practicum, which we are supposed to follow. So this is the program schedule for the day. Followed by that, at the end of each session, you may bring up your questions, which will be answered by the experts. Apart from that, we also have a discussion session, which is finally being held from 4:15 to 4:30. So in case any of the question which has not been answered, or you still feel some questions require more amount of information, please do put again in the chat box so that we can have a discussion session. At the end, we will have a post-test and feedback. So with this, the day will come to an end by around 4:45 p.m. Now, I request our registrar, Tamil Nadu Nurses and Midwives Council, to share her views about this workshop. Madam, over to you, ma'am.
Yes, thank you, Nalini. Am I audible? Am I audible to everyone?
You are audible, ma'am.
Okay. A warm good morning to everyone from all the districts which you are participating today. And I really thankful to my core team and my resource persons, all the people who really toiled during the 8 days workshop and gave a great result. And really people went out with the fruitful information for in the on-site program. I wish and I'm hoping that these 3 days virtual workshop will give you a cover for all the faculty. And I'm sure not only these 300 participants, I know some of you have been put up your LCD and relaying it to all the faculty. If it is so, I'm really happy that if every institution has arranged that, so that all of you can come to understand and how this is going to be implemented. What is it? Because everyone may think the syllabus and curriculum, what is that? That's just the syllabus I can implement. Is there a problem? Yes, of course, there are little bit of nitty-gritty things are there. Of course, you are all experts, but still, we need to know we are not used to a grading system or to the credit our system. So it is new to all of us, including me. So we need to understand how to proceed with this when it is being implemented. And I still would like to remember the first day, Dr. Lata Ravichandran from medical education from SRMC shared what is the syllabus and the curriculum. I keep telling in all my 4 consecutive workshops which conducted on site, and here I would like to repeat that to each and everyone. Syllabi is nothing but, she said, udiri poo. Nama poo katrathukku munadi poo irkullaya udiri pookal, and curriculum is like a mala, that garland. Okay. So it is nothing but we used to tell this, in the Western countries, they give components like Udripur Madri components kudupanga. With that curriculum being made. Here, Indian Nursing Council has given a syllabi cum curriculum, which we are going to implement it. How are we going to implement it? Is it feasible for all of us? Because some of the places, for example, community health nursing, it comes in both in the 4th semester and the 6th semester, both odd semester it is coming. So 6 months period, the students are not going to be in the community area at all. So how to handle that one? Or when it comes to theory hour, it is 20 hours is equal to 1 credit. In a practicum, when it comes to clinical hours, 40 hours is equal to 1 credit hour. And when it comes to clinical hours at the internship, it comes about 80 hours is equal to 1 credit. So you need to know, because it is not the principal, vice principal all the time with the student. The faculty, you are the instrumental, and you are being with the student always. Either it may be a class coordinator or taking some of the subjects with them, and you are easily accessible to the student. So you should know the importance of explaining to them what it is, because it's entirely new. The education system, what we studied also only percentage basis, mark basis, right? Out of 100, how much mark you have obtained based on that. But fortunately, I think new educational policy, which is implemented in 2020, in that system, students who are studying, they are going to come out with the grading point and credit hours. So it will be easy for that one to reach after 12 years. But now the existing students to come out with that credit system, how are we going to tackle, and how are we going to explain to them, each and every student, maybe even to the parents, they are not used with this. So we need to educate ourselves. That is the main motto of this program. And also, when while implementing, uh, is it feasible for giving, for example, if it is third semester, you're getting psychiatric posting, most of the institutions, they come here into IMH. Is it possible within that odd semester, is it possible for every institution get an exposure of IMH there? So we need to think of an alternative for these sort of things. So all these are going to be answered in this one-day workshop. Already your principals are equipped with this information. Maybe even if we miss out one or two points, you definitely can get in consultation with your principal or vice principal. You will be getting a answer for all your queries. But however, we will try to give you the full set of clarification, how much ever possible, within this one day of a time. The span of one day is very, very short, and I know it is not, you know, you people are the one who are implementation stage, and you may have much more doubts than the principal, vice principal, I expect. So this forum is going to give you a great insight about this new revised BSc nursing curriculum, where we are not going to talk about distinction and all that, but we are going to talk about A plus B, C, and that way we are going to talk about it, the grading system, and also the ranking system, how to give a rank for the students after all these things is over. Like each semester is going to be called as a course. It is not going to be a subject. Usually we are used with first year subject, second year subject, third year subject, like that. But now we are going to be telling each semester is one course. Okay. And also the SGPA, the grading point for the semester. Okay, for accumulative point, how to do it in the formative method and the summative method, how they are going to have nice participatory sort of a lecture. If you are cooperating very well and you can come up with the questions, they will be answering you. Definitely, I'm sure my core team would have planned for some workouts at least for the faculty to do with the SGPA calculation and CGPA calculation. It may sound something new, but it is very easy for all of you. And also regarding the transcript also, we are much worried that we have discussed with your principals, because when it is a grading point, one semester you will have total 26 weeks, out of which 22 weeks only each one of you going to have it. So how to give the postings, and you are the one going to take the students to the hospitals, where most of you depend upon the government hospitals, where all of you been pooled at one time in the morning shift, and definitely students cannot get an exposure of hands-on experience. So we have discussed that also, trying to make it to the shift system, whether we can do it. All that we have discussed. I'm expecting when we are implementing, we should be able to do that. And also there is a mandatory module and a elective module. So mandatory module, which is interwoven with the semester itself in the subject. So it is quite easy. There are a lot of Government of India apps and other things are there. But elective module, though there is a component here and there in your subjects, there is not definitive one which is there. So council has taken up the responsibility of developing the 17 elective model as an online module. So that falls on 4th semester and 6th semester and in the 7th semester, where we are going to provide to the students all the 17 elective model, where out of which he has to take one model whichever he likes. So that is the point. All those things we are going to be discussing with you on this day. And also I am sure that will be very easy for all of you, because once in the remote villages like I would say like now Kallakurichi, Thiruvannamalai and remote areas where you don't get an expert to teach some of the subjects, where this elective model will be very much helpful. And if you could get a person in person to teach them, that is also much appreciated, so that this online module will be an added advantage to the students to develop his own credits for his future. And also I wish each and every institution should look for NAC accreditation as an independent unit, so that it will be a competition, the star rating competition among the colleges. That should be a healthy spirit of this. Not only deemed university should go for a NAC accreditation. I wish independent institutions like colleges of nursing independently should look forward for these sort of things, so that there will be healthy competition, and also the college also will get its fame, and so that you get a good admission. The teachers also equip yourself very much in these aspects. And here, before I forget and before I conclude, I would like to thank each and every one of you. The last 2 years, the GCR classes, you did a marvelous job, and you all did a great, you all shown a great cooperation and responsibility of teaching your students and preparing the PPT and posting it in the GCR classroom in time, and all those things. You did a wonderful thing. I would like to thank on behalf of Tamil Nadu Nurses and Midwives Council, and also the student. They showed a extreme enthusiasm to participate, and we got a great feedback about that. So my dear fraternity, I'm really very proud of you, and I'm very, very glad that I could meet you through virtual mode. But if it would have been easy to meet all of you in on-site mode, it would have been much more a fellowship and relationship we could have established, but it is not possible to make throughout Tamil Nadu to do that. So maybe we will look forward some other program for the like LEAP program, the second level leadership program. We are planning for something, so that I will meet you all soon. And I wish each and every one of you to have a great deliberation today, and it will be a feast to you to the ears, and also you will enjoy this new implementation of a curriculum revision, because I almost attended all the 8 days in between, but still I'm sure I attended the whole 2 day session. I really enjoyed and looking for the challenges, how we are going to implement, how we are going to do the transcript, how our students are going to do this mandatory module, elective module. So it's going to be really, nice and also very challenging situation where we are going to face, and also we are also going to learn, and our students are also going to learn. I wish each and every one of you good luck and enjoy your sessions today. Thank you so much. Over to you, Nalini.
Thank you, ma'am. Ultimately, I should say, under your leadership, you have been keeping each of the faculty member very, very focused with the goal, and you are helping them, keeping them motivated to do their best. And this actually, the success initially should go to you, because you're very clear that every faculty should get a sensitization. I would like to introduce the core team members also in this forum, and the resource faculty. I hope this is visible for you. Is that visible? Yeah. You can see the chairperson for this conference is Dr. Annie Grace Kalaimati, and I'm the core coordinator. And I also have my two colleagues there, co-coordinators, Dr. Sharda Ramesh, the Deputy Director of Nursing Research and the Principal of Vinayaga Mission College of Nursing. And I also have the proud privilege to introduce Dr. Kandaswamy, who's from Dharan College of Nursing, Salem. So we also have a great team of resource faculty, the experts who are going to be here for the next 3 days. So it's Dr. Maragadam, we have Dr. Kavimani, We have Dr. Anita Rajendra Babu, Dr. Helen, Dr. Jayasudha, Dr. Reena Evensi, Dr. Kanchana. We have Dr. Prema Shekhar, Dr. Sudha, Dr. Sushila, Dr. Annie Raja, Dr. Vijay Lakshmi, Dr. Margaret Ranjidam, Dr. Fabiola, and then we have Dr. Hepzibah Sharman. So these are going to be the resource faculty for the next 3 days. So after this introduction, let me go on to encourage each and every one of you to participate in the pre-test, which is now being projected in the chat box. So you can see in the chat box, the link is pasted for all of you. So I have pasted a link in the chat box. You can see the link there. This is the pre-test link. We'll just give you about 15 minutes time to complete the pre-test. Hope you are able to see in the chat box the link that is pasted. Please open the link in the chat box. I'm just pasting once again. You can see the link. Please open the link and complete your pre-test. Hope the pre-test link is working for all of you.
Tell them to put a thumbs up or anything
Hope
problem.
you're able to access it. Just put a thumbs up message in the chat box, please, so that we are aware that you're able to access the link. Okay, I can see a yes, ma'am. Thank you. Thank you so much, Dr. Abhirami. Yeah, thank you. You can continue. It's visible. Gentle reminder to keep your videos on so that we are able to visualize and take photos as and when required. Keep your videos on. I also have a request from the Tamil Nadu Nurses and Midwife Council. Kindly rename. You can just see your picture there. If you give a right click, you can rename. See to that you have your name first, followed by that the name of your institution. So this will help the Tamil Nadu Council to give you credit hours. If we fail to add on our institution name and our name properly, you will miss the credit hours. So again, gentle reminder, see to that you add your name and the institution name. In the pic, you are able to see on your own face. Just go right click. You can see rename, click the rename and add your full name. Followed by that, you can add your institution name. So that becomes the title for you. In case you have not done, please do that. If you have done, please ignore this message. I can see all of you are almost completing the pre-test. Another 3 minutes more to complete your pre-test. So hope all of you have completed the pretest. The time limit for the pretest is over. Now we will move on to the session. The first session for the day is going to be on introduction to revised BSc Nursing degree program and the regulation. And the objectives for the session is you will be able to recognize the program outcomes and the graduate attributes at the end of this session, and also interpret the new regulations that has been laid down by BSc Nursing degree program. I invite Dr. Sudha, Principal, M.A. Chidambaram College of Nursing, to give her expertise on this particular area of introducing the BSc Nursing revised curriculum. Over to you, Dr. Sudha.
Thank you, ma'am. Is my screen visible, ma'am?
Yes, Dr. Sudha, it's visible.
Okay.
You can proceed.
Well, the most respected registrar, ma'am, Dr. S. Annie Grace Kalaimadi, the core team members, and my dear nursing fraternity. Great morning to all of you here on the virtual platform. First of all, I would like to thank our registrar, who is always keen about the profession and for the welfare of the nursing fraternity. I really thank Madam for taking such an initiative to spread the message about the new curriculum so that everybody will have a common understanding, so that implementation will be successful and we can raise the standard in the state of Tamil Nadu. Let me start my presentation. It is about the introduction about the new curriculum. I hope all of you could have seen the syllabus, you could have gone through. So my points, whatever I'm going to discuss, it is only highlight about the new syllabus. So at the end of the session, I want all of you to recognize the program outcomes and graduate attributes and interpret the new regulations laid for BSc Nursing degree program. So I want all of you to understand about the title, that is Indian Nursing Council Revised Regulations and Curriculum for BSc Nursing Program, Regulations 2020. Please look at it. You are supposed to write BSc Nursing the way it is projected here, BSc, C small letter and within bracket nursing. Whenever you want to write your program name, you are supposed to write only this, not BSc N. This is the way you are supposed to write BSc Nursing. And the title for the syllabus, the new syllabus or the new curriculum is Indian Nursing Council Revised Regulations and Curriculum for BSc Nursing Program, Regulations 2020. So before moving on to the subject, I would like to introduce few terminologies which we in common use it. Even in our introduction, Madam has highlighted about the syllabus and the curriculum in a beautiful way. So what is the difference between subject, course, and program? Subject is an area of knowledge that is taught in an educational institution. Course is a series of lectures or classes taken to fulfill the requirements of a subject. Program is a series of lectures or courses to complete a program or attain a degree. For example, if you take a subject which will be placed in a short term or even few weeks or 1 semester or 2 semester. For example, if you see community health nursing, though it is a 1 and 2, it is placed in two different semesters now. Earlier, it is spread in the 2nd year and 4th year. And one subject, for example, microbiology, which was placed in the 1st year in the previous syllabus. So course means again it is short term. It also ranges from few weeks to 1 semester. And program, it is long term, which will usually consist of multiple semesters around 3 to 4 years. So on completion of a subject, that means when you complete a subject, you will have to appear for exam. Either you will pass the subject or you will get the grade. And in case of course also, you will get a grade. So synonymously, a subject is known as also a course. But often we interchange the words like course and program, BSc Nursing degree course and BSc Nursing degree program. So I want all of you to understand course means it is subject. So synonymous, like subject and course may be a synonymous, not course and program. Program is again long term, which consists of multiple semesters around 2 to 4 years. For example, if you take MSc Nursing degree program, it is 2 years. If it is a BSc Nursing program, it is 4 years. So after completion of program, you will get a degree and you will get a degree certificate. And whereas when you complete your course, you will get only a pass or grade, pass or fail or grade. So program, you will get the degree or certificate. So please avoid using don't say BSc nursing course. It is BSc nursing program. Whereas nursing foundation is a course, which is also a subject. So for example of the subject is nursing foundation. Subject and course is similar. Like, the example is nursing foundation, microbiology, sociology, whatever it is. And program, BSc nursing, MSc nursing, diploma in general nursing and midwifery. I hope all of you could have understood the difference between course and program, and subject and course can be used in a similar way. There are few words used in your new regulations. I want you to just, refresh, like act. It means the Indian Nursing Council Act of 1947 as amended from time to time. So the next term is council. Council means Indian Nursing Council, constituted under the Act of 1947. SNRC means State Nurses and Midwives Registration Council, by whichever name constituted and called by the respective state governments. For example, in our Tamil Nadu, we have the Tamil Nadu Nurses and Midwives Council. In other state, maybe a Karnataka Nursing Council, Kerala Nursing Council. BSc Nursing means the 4-year BSc Nursing degree qualification in nursing, recognized by the Council under Section 10 of the Act and included in Part 2 of the Schedule to the Act. If you read the Indian Nursing Council Act, which is there in the INC website, you just go through for your better understanding, which is under Section 10 of the Act, which is included. The qualification BSc Nursing is included, and also it is included in the Part 2 schedule. If you see, there is a Schedule 1 and Schedule 2. It is included in the Part 2 of the Schedule to the Act. So authority means an university or body created by an act for awarding the BSc Nursing qualification. Here, Tamil Nadu Dr. MGR Medical University, we have. School of Nursing means recognized training institution for the purpose of teaching of the diploma nursing course, that is general nursing and midwifery course. College means a recognized training institution for the purpose of training and teaching of the BSc Nursing course. CNA means continuing nursing education to be compulsorily undergone by the registered nurse, registered midwife, registered auxiliary nurse midwife, registered lady health visitor for renewal of registration after every 5 years. This is in practice in our state of Tamil Nadu. I hope all of you are renewing and your license is active. So BSc Nursing degree program. It is a 4-year full-time program which consists of 8 semesters. That is what something new from the old syllabus, which prepares BSc Nursing graduates qualified to practice nursing and midwifery in settings like public, government or private. It also adopts credit system. Even in our register, in her address, she said the credit system is something which is new we are going to add. We are going to follow in the implementation of the new syllabus. The credit scores are different for the theory, practical in the laboratory, which you will come to know. And I'm sure you could have already gone through. It is also suitable to professional education in a hybrid form. It encompasses foundational, core and elective courses. If you see, the entire courses are divided, the foundational, core and elective courses. Core courses means the major courses like nursing, foundation, medical surgical nursing, community health nursing, child health nursing, mental health nursing, obstetrics and gynecological nursing. Elective courses, that's what madam said, elective courses, like the students has the option to choose elective courses. Foundational is basic and behavioral courses. Like we have a psychology, sociology, all these are foundational courses. And choice-based credit system is applicable to electives only. That is what, electives are placed in different semesters, and these are all choice-based system. That means the students have the option to choose any one of the elective courses. The student has the freedom to choose, which is applicable to electives only. That means there are modules which are mandated. So in every semester, there are mandatory modules, and in 3 semesters, there are elective courses also present, and is offered in the form of modules. So modular learning is something new in the syllabus, which is also included. So modular learning is integrated as well as in the foundational as well as core courses, that is mandatory. That's what I said. In every semester, if you see at the end of the semester, mandatory modules are given. Apart from it, elective courses are given in 3 semesters. So mastery of competencies is the main focus. That is what we have to aim from the students. Students are provided with the opportunities to learn a whole range of skills through learning in skill lab, simulated lab, and clinical environment. So you can understand skill lab and simulation and clinical environment. So the new syllabus aims to provide a wide range of experiences for the students in various areas. It embraces competency-based and outcome-based approach, and it also integrates mastery learning and self-directed learning. All this modular learning is self-directed learning. Mastery and competency-based approach is already expressed in the previous syllabus, but which is given more emphasis in the new syllabus. So transformational and relationship-based educational approaches are emphasized. The transformation which we want our students to undergo from the first year to final year. That is what the outcome of the graduates, BSc Nursing graduates, and the relationship-based educational approach. Even now we have the practice mentor-mentee that is mainly based on relationship. The kind of relationship which exists between the teacher and the student is something really good. So relationship-based educational approach is also emphasized in the new syllabus. And competencies in various areas are expected. Here I have listed down like competencies in cultural diversity, understanding the cultural diversity, use of communication technology, teamwork, be a part of a team, and collaborating with other healthcare team members, safety, promoting safety of the self as well as the patients, and improving quality, performing therapeutic interventions, and following evidence-based practices. So competencies in all these areas are expected from the students. So students are prepared to provide safe and competent care. Again, it is what repeated in the introduction, to provide, care to the patients across lifespan and influence patient outcomes. So these are the aims listed down in the syllabus. Like the first aim is to prepare knowledgeable, competent nurses and midwives with the critical thinking skills, responding to the changing needs of profession, healthcare delivery system, and society. So you can underline the word knowledgeable, competent nurses. This is what, throughout the syllabus it is emphasized. So competency-based approach and outcome-based approach, that is also there. So knowledge as well as competency has to be equally balanced, and the students are supposed to be helped to develop knowledge as well as competency, and to assume responsibilities as professional, competent nurse and midwives in providing promotive, preventive, curative, and rehabilitative healthcare services in any healthcare setting. See, the first one is new, the second one is there in the previous syllabus. And to make independent decisions in nursing situations within the scope of practice. Again, the scope of practice. So I hope all of you know what is the scope of practice. So the scope of practice defines what a nurse, professional nurse, supposed to perform as a nurse, because you are all, once you complete your degree, you are registering yourself with the Tamil Nadu Nurses and Midwives Council, like RN RM license. That license gives you the permission to practice your profession. So what you are supposed to practice, that is whatever you learn in your 4-year period, that means the procedures or whatever thing listed down in the logbook. So if you see the Tamil Nadu Nurses and Midwives Council website, your scope of practice means it is there in the website, the front page itself, the main page itself. The scope of practice refer logbook. That means whatever you perform in the logbook, that is your scope of practice. So the student should be prepared to make independent decisions in nursing situations within the scope of practice, protect the rights of individuals and groups, and conduct research and apply evidence-based practice. Again, to assume the role of practitioner, teacher, supervisor, and manager in all healthcare settings. Again, the role of practitioner is included in this syllabus. So practitioner is a person who practices their own profession. So what we practice, whatever within the scope of practice. So this knowledge, this understanding we should have as a teacher, and we also should inform our students so that the students should know what they are supposed to do, what they are not supposed to do, what is their scope of practice. Even if anyone questions them, they should be bold enough to tell, this is what my scope of practice. Within my scope of practice, I am practicing everything. So this is objectives. Again, on completion of BSc Nursing program, the BSc Nursing graduates will be able to utilize critical thinking to synthesize knowledge in the practice of professional nursing and midwifery. Again, prepare knowledge and competent nurses. Again, Provide promotive, preventive, and restorative health services in line with the national health policies and programs, which is also included in AIMS. Integrate professional caring into practice decisions that encompass values, ethical, moral, and legal aspects of nursing. Respect the dignity, worth, and uniqueness of self and others. So ethics and values are given weightage here. Apply concepts of leadership, autonomy, and management to the practice to enhance quality and safety in healthcare. Utilize the latest knowledge and skills related to IT to enhance the patient outcomes. So nowadays, students are very skillful in using the technology. They are better than the teachers. Even they are better than our generation because they are most updated with the technologies. So they also should be taught how to utilize those technologies in a better manner for their education as well as for the patient care. So communicate effectively with the patient's peers and all healthcare providers. Utilize the requisite knowledge, skill, and technologies to practice independently and collaboratively. I said competences in the areas like communication and teamwork. That is again reflected in the objectives. Integrate research findings and nursing theory in decision-making in evidence-based practice. Again, the word evidence-based practice is repeated. Accept responsibility and accountability for the effectiveness of one's own practice and professional growth as a learner, clinician, and leader. So accept responsibility and accountability for one's own practice. That's what, whatever a nurse performs, it is within the scope of practice. When you perform within your scope of practice, you are responsible and you are accountable as nurses. So the same concept should be imbibed to the students. Participate in the advancement of the profession to improve healthcare for the betterment of global society. So these are the competencies, core competencies listed down. Like there are totally 10 competencies. One is patient-centered care, professionalism, teaching and leadership, system-based practice, health informatics and technology, communication, teamwork and collaboration, safety, quality improvement, evidence-based practice. Now, if you see all these 10 core competences, it is not something new. It is all introduced in the objectives, aims, as well as in the introduction. Let me briefly explain each competency. Patient-centered care, which means providing holistic care, recognizing individual patients' preferences, values, needs, age, and culturally appropriate care. That is providing holistic care. Professionalism, that is demonstrating accountability for the delivery of standard-based nursing care, which is consistent with the moral, altruistic, legal, ethical, regulatory, and humanistic principles. Again, I said no, ethical and legal, all these values are given weightage here, professionalism. Teaching and leadership, influence the behavior of individuals and groups and facilitate establishment of shared goals through teaching and leadership. Because nurses as educators, when they work in the clinical setting, they can influence the behavior of the individuals and the families in their workplace. System-based practice, demonstrate awareness to the context of healthcare system and manage resources to provide optimum quality of care. Nurses work in various areas like, school health, primary health care, and district hospital. So wherever they work, they should be, sensitive to the context of healthcare system, and they are supposed to be able to manage the resources available in the place where they are working to provide optimal quality of care. Health informatics and technology, that means using technology and collaborate to make critical decisions that optimize patient outcomes. So communications, interact effectively, fostering mutual respect and shared decision making to enhance patient satisfaction and health outcomes. Teamwork and collaboration, so function effectively within nursing and interdisciplinary teams, fostering open communication, mutual respect, team learning and development. Like nurse is one among the healthcare team member, and she is the pivot among the healthcare team members. She should have an open communication to promote coordination. Safety, minimize risk of harm to patients and providers through both system effectiveness and individual performance. System effectiveness means that is the system with which she works and her own talents, her own competencies and knowledge. So both she has to use it effectively to minimize the risk of harm to the patients. Quality improvement, use data to monitor the outcomes and use methods to improve quality and safety of healthcare system. Evidence-based practice, identify, evaluate, and use the best current evidence coupled with clinical expertise and consideration of patient preferences to make practical decisions. So this is about core competences, 10 core competences listed in the syllabus. And if you see, you could see the same thing which is reflected, highlighted in aims, objectives, and the competencies. A quick review of qualifications of a teaching faculty members in the college. So principal cum professor, a total of 15 years of experience with MSc Nursing, out of which 10 years after MSc Nursing in the collegiate program is required. So earlier, if you see, it is a 5 years. It was 5 years in the collegiate program. Now it is a 10 years. The standard has been improved. Vice principal cum professor, total 12 years of experience with MSc Nursing, out of which 10 years teaching experience after MSc Nursing in the college. So earlier it was also 5 years. So professor, total 12 years of experience with MSc Nursing, out of which 10 years teaching experience after MSc Nursing. Earlier it was 10 years, now it is 12 years. Associate professor, it remains the same. That is total 8 years experience with MSc Nursing, including 5 years teaching experience. Assistant professor, MSc Nursing with the total 3 years of teaching experience, that remains the same. Tutor, MSc Nursing is preferable, and BSc Nursing post-basic so for principal to assistant professor post, essential qualification is MSc Nursing and PhD Nursing is desirable. So if you see the teaching composition of members for a 40 to 60 intake, 61 to 100 intake, maybe just for your understanding. So principal, because I hope there are many seniors attending this program, for your understanding. So for a 40 to 60 intake, principal 1, vice principal 1, professor 1, associate professor 2, assistant professor 3, tutor 8 to 16. That is strictly 1:10 ratio, which is also included principal. Earlier 1:10 ratio, which does not include the principal. Now the principal is also included in the calculation of teaching faculty. So for example, 40 intake, 4 years means 160 students. 1 year 40, 4 years 160. That is what the total is 16. And 60 students means per year 60, 4 years 240. The total strength is 24. Same thing for the 100 also. 4 years 400 students, 40. So for 40 intake, I already explained. So minimum 3 MSc Nursing faculty shall be appointed. So for 40 students, the teaching requirement is, I said no, minimum 3 MSc Nursing. So first year minimum 3 MSc Nursing. That 3 MSc Nursing should be 2 from medical surgical background, 1 with the pediatric nursing, MSc in pediatric nursing, plus 2 tutors is required. So totally, if you see 2 plus 1, 3 plus 2, 5, right? So second year, 5 MSc Nursing. So 2 is added, again 2 medical surgical, 1 pediatric, 2 addition is from 1 community health and 1 psychiatric, and plus 3 tutors. If you see at the third year, 7, 5 to 7, 2 more is increased. That is 2 from OBG. That is you have 5 members from second year will be working for the third year. Additionally, you need to appoint 2 OBG specialty, MSc with OBG specialty, and 5 tutors. That is 3 plus 2, 5 tutors. If you see the final year, you require 8 MScs. And again, if you see, it is 2 medical surgical, 1 pediatric, 1 community, 1 psychiatry. So they all will be continuing, and 3 OBG. So 1 more OBG. That is 7 to 8, only 1 addition, that 2 with the OBG. Though it is given the specialization for different years. Again, it is all already discussed with the principal and vice principal. For your understanding, we have explained, and your principal and vice principal will tell you. So this is about 60 students. Maybe let me explain. For first year, to start with 3 MSc Nursing, second year 5, third year 7, and 4th year 8. It is also the same as that of 40 intake. Only thing, the number is changed in the tutor level. Otherwise, it is the same. Only the major changes in the 100 intake, where your institution is going for 100 intake of students. Starting first year it is 5, second year 8, third year 12 MSc, and fourth year 16 MSc nursing faculty members. But you can also see the changes in the number of tutors. So clinical requirement for 60 intake. Like these are the distribution of beds given, like medicine 50 beds, surgery including OT 50 beds, OBG 50 beds, pediatrics 30, orthopedics 15, emergency medicine 10, psychiatry 10. And I know there are senior faculty members who will be going for inspection in the university or the council. You should know what are the requirements, so that it will be useful when you go for. As well as when you are working in the college, you also should know what is the requirement as per the norms. So you can also, the institution can also go for affiliation. So for affiliation, like community health nursing, mental health nursing, specialties like cardiology, neurology, oncology, nephrology, orthopedics, communicable infectious diseases, they can go for affiliation, including obstetrics and gynecology and pediatrics. And to start a nursing college, you should have a parent hospital. Besides parent hospital, the institution can go for affiliation for these experience for these areas. So what are the other additional facilities required? Like community health nursing, you have to have either own or affiliated rural and urban center, major OT, minor OT, dental, otolaryngology, ophthalmology, burns and plastic unit, neonatology, communicable disease, respiratory medicine, TB and chest diseases, dermatology, cardiology, all these are listed out. Nephrology, ICU, ICCU, geriatric medicine. So all these are required to provide varied experiences for the students. There are certain points to remember. As I said already, 100-bedded parent hospital or own hospital is required to start a nursing college. The parent hospital bed occupancy should be minimum 75%. Not only in parent hospital, even the hospital which is affiliated, there should be a 75%. Minimum bed occupancy should be 75%. And as per the subject requirement or as per the course requirement, educational visits to be organized by the principal. And parent and affiliated hospital, the staff SIU norms, staff inspection unit norms should be followed. That is how many nursing superintendent, assistant nursing superintendent, deputy nursing superintendent, and what is the patient and staff ratio which is there in the staff inspection unit. You go through and update yourself. And in parent as well as affiliated hospital, the student should be given the status of nursing students. And maximum distance between the institution and the hospital should not be more than 30 kilometers. In hilly and tribal, the maximum distance can be 50 kilometers. Student-patient ratio should be 1:3. In any hospital, if you see, 1/3 of the bed should be for medical, 1/3 of the bed should be surgical, and not less than 1/6 of the total beds should be available for male. Because I know sometimes with the maternity hospital, if they start the nursing college, again, the number of beds for male will be less. That is the reason they have mentioned. Minimum 100 deliveries per month should be there. Provision for clinics in health and family welfare and for preventive medicine also should be present in the parent hospital or in the affiliated hospital. So again, 1:10 teacher student ratio, as I already said, principal is also included. Principal, vice principal, and all faculty shall take classes, perform clinical teaching and supervision. Every faculty, including principal, shall spend at least 4 hours each day. So you can expect your principal and vice principal coming for the clinical supervision, and one tutor need to stay at the community health field and on rotation. Salary in private colleges of nursing should not be less than what is admissible in the government college of nursing or as per the UGC scales. Nursing service personnel should actively participate in instruction, supervision, and evaluation of students in the clinical and community area. So in your parent hospital, affiliated hospital, you have to better involve the nurses working in the clinical side and for both teaching and evaluation of the students. And teaching faculty of the College of Nursing should work in close coordination with the nursing service personnel. So you can go, as soon as the clinical posting is started, you can go discuss with the staff nurse. Definitely you will have a rotation plan, but in the ward rotation, definitely you can discuss with the staff nurses. You can plan, and work can be allotted so that the students will have a better learning experiences. Both personnel should be deputed to attend short-term educational courses, workshops, and conferences. That is, the staff nurses working in the hospital as well as the college should be deputed. College authorities should treat teaching faculty of College of Nursing with respect and dignity when nominated, selected for the purpose of examination or inspection. 50% of non-nursing courses subjects should be taught by the nursing faculty, supplemented by external faculty with a postgraduate qualification. Even now, there are many institutions like psychology, sociology courses are taught by nurses. You can teach 50% of the non-nursing courses, and you can be the examiner too for the taught courses. And few information about admission, I'll just quickly review. So minimum age for admission is 17 years as on 31st December of the admission year. Maximum age for BSc nursing course is 35 years. 10+2 with a minimum of 45% marks in physics, chemistry, biology taken together, and pass in English is mandatory. And there is a 5% relaxation for SC, ST, OBC candidate, and there's a pass in English. And state open school recognized by the state government and National Institute of Open School recognized by the central government having science subjects and English. Students studied in those institutions studied in English are eligible. Science subjects and English are eligible. English is a compulsory subject in 10+2. So the new inclusion is colorblind candidates are also eligible, provided if corrective lens and spectacles are worn. Married candidates are also eligible. Candidates should be admitted only once in a year. They should be medically fit, and 5% disability reservation for disability of locomotor to the tune of 40 to 50% of lower extremity. You can still admit for the BSc nursing program. And upper age level shall be relaxed by 5 years for disabled candidates. Even the transgender candidates are also eligible to get admitted into the nursing program. So this disability should be certified at the district level. There is a committee, government committee, and they issue the ID card, and they will state what type of disability and what is the percentage. So these are the records for the students, because you are in a key position to handle all such records. So please note those. These are the records to be maintained for the students, like admission, health class, clinical and field experience, internal assessment, mark list, record of extracurricular activities, leave record, practical record books. And these are the records to be maintained for each class or batch wise. For course, record of the academic performance, rotation plans, all this like affiliation, grant in aid, cumulative record, record of educational activities, annual reports, achievement of the college. All these records, definitely I'm sure all senior faculty members will be attending, and you all are involved in maintaining those records. So transcript, even our registrar has told about the transcript, a common transcript. All institutions to issue the transcript upon completion of the program and to submit only one single copy of the transcript per batch to the respective state nursing council. So with this, I'm completing my presentation. So any questions?
Participants, if you have any questions, do post them in the chat box for the experts to answer. I'm not able to see any questions as yet. If you have any questions, please do share it in the chat box.
Nalini, I think we can collectively attend the question and answer at the end of the session. That is not the time now.
Yeah.
Yeah, so you can let them type the question so we can collect it. Okay.
Sure, ma'am. Yeah, definitely. Okay. Thank you, ma'am.
Thank you, ma'am, for the wonderful opportunity. Thank you so much.
Thank you, Dr. Sudha. So that was a brief introduction of what changes you have seen in the BSc nursing curriculum currently. Now we will move on to the next session for the day. I have the privilege to invite the next speaker for the day, who is going to speak on the program structure with credit. And it's going to be Dr. Fabiola Dhanraj, the principal of Meenakshi College of Nursing. Fabi ma'am, are you there? Over to you, ma'am.
You're able to see my slide, Dr. Nalini?
Yes, ma'am. Can you put it in slideshow view, ma'am?
Okay.
No,
Is it visible now?
it is not in slideshow. No.
Now, Dr. Nalini?
No, we're not
Fabi,
able
you
to.
just
It's okay.
I'll just continue. Okay.
Yeah, you can just proceed, ma'am. You can go slide by slide, no issues. Just increase the slide size alone so that it's easy for them to view.
In my computer, it's on slideshow, Dr.
Yeah,
Nalini.
it happens sometimes, ma'am, with the net.
Fabi, maybe you put off your video
Okay.
so that it will be easy. Sometimes wavelength. Okay. All right. Internet errors.
Good morning to everybody. At the outset, I would like to thank the Council for giving the opportunity to present this topic on highlight program structure with credits. I'd like to thank the guiding force behind us, Dr. Rani Grace Kalaimati, the Registrar of the Tamil Nadu Nurses and Midwives Council, and the core team who really backed all the resource person and guided us through the presentations. Coming to my presentation, I'm just going to briefly highlight on the program structure with the credits. The objectives of the short presentation is identify the course offered in each semester, infer the break semester system, cite the allotment of mandatory and elective
Fabi, ma'am,
Fabi.
sorry to disturb you. Fabi, ma'am.
Tell me, Dr. Nalini.
I think your slides are not moving. Can I share the slides for you if you don't
I
mind?
think it would be better.
Yeah, they just come out so that I can share the screen.
I stopped sharing.
Yeah. One second, ma'am.
ஊற வச்சு சாப்பிடுற மாதிரி இங்கெல்லாம் வலிக்கு எனக்கு தூக்கம் முடியுது.
What happened, Nalini?
Yeah, one second, ma'am. I'm sorry.
The last one which was sent, no? For virtual presentation.
Is that visible, ma'am, for you? Fabi, ma'am, is that visible?
Yes, Dr. Nalini.
Yes, you can proceed, ma'am.
Okay, going to the objectives of the presentation, there are 4 objectives which are highlighted. Identify the courses offered in each course in each semester, infer the break semester system, cite the allotment of mandatory and elective module across the semester, and associate the distribution of credits in each course. Next slide. Next slide, Dr. Nalini. So it's a review of what Sudha had, Dr. Sudha had already mentioned. It's BSc Nursing program, and it is also known as a credit system and semester system. And it's a 4 years course with 8 semesters. So we call it as a BSc Nursing program. And most of the time, people are very comfortable by using the word subjects. We don't call it as subjects, it is courses. And across the 4 years, we have 30 courses which the students would be undergoing. So 30 courses for 4 years, and it is in a duration of 8 semesters. Next slide, please. So coming to the first semester, you can see there are 3 rows in the first slide. One says the university code, the next is the course code, and the course subject title. So the course code is the course code which is given by the Indian Nursing Council, which we should not change at all. It is, if the universities, there are many universities like Meenakshi University, SRMC, SRM and other universities, we can prefix the concerned university can prefix a code before the Indian Nursing course code. So do not make any changes in the Indian Nursing course code which is given, but we can prefix a particular course code in before the course code given by the INC. So in the first semester, students study around 5 subjects, 6, sorry, communicative English, applied anatomy, applied physiology, applied sociology, applied psychology, and nursing foundation 1. Over here, you can see I've highlighted something which is known as first aid modules. Let me tell you that there are 11 mandatory modules which the student should undergo, and there are 17 elective modules which the students can take a choice. So in the first semester, there is a mandatory module which is known as first aid module. Then coming to the self-study co-curriculum, again, there are certain credit points even given for this first semester. Next slide, Dr. Nalini. Coming to the second semester, I left a column empty for the university code. INC code should not change again. Coming to the core subjects are applied biochemistry, applied nutrition and dietetics, nursing foundation 2. In the first semester, we saw nursing foundation 1. So in the second semester, you will see nursing foundation 2. Additionally, you can see the second mandatory module, which is the health assessment module over here. Then the next subject is health nursing, informatics and technology. And of course, like I told you, in every semester throughout, they have the self-study or the co-curricular. Coming to the third semester, they undergo the courses like applied microbiology, infection control, including safety, pharmacology 1, pathology 1, adult health nursing 1 with integrated pathophysiology, and the third mandatory course, that is the BCLS module. And of course, the third semester also has the self-study or the co-curriculum. Coming to the fourth semester again, they have pharmacology 2. And over here, you can see the fourth mandatory module, which is the fundamental of prescribing module, and pathology 2 and genetics, adult health nursing 2 with integrated pathophysiology, including geriatric nursing. And in this semester, they have 2 mandatory modules. The second one is the palliative care module. Then they study the professionalism, professional values, and ethics, including bioethics. Again, like I told you, they have the self-study or the co-curriculum. So going on to the next semester, before they go to the next semester, the break semester comes for the students. In the break semester, you can see that they have to clear all the subjects before they go on to the 5th semester. So in the, unless, like they can carry on with the 5th semester, but they cannot write the exams of the 5th semester. Next slide. So in the 5th semester again, they study the child health nursing 1. Over here, they have 4 mandatory modules, that is the essential newborn care, facility-based neonatal care, and the third module is integrated management of neonatal and childhood illnesses, and pediatric life support module. You can see there are 4 mandatory modules which are integrated in the 5th semester. Mental health nursing 1, community health nursing 1, including environmental sciences and epidemiology, education and technology, nursing education, and there's a new subject which is also introduced, which is the introduction to forensic nursing and Indian laws. Coming to the 6th semester, they go on with child health nursing 2, mental health nursing 2, nursing management and leadership, midwifery, obstetrics and gynecology nursing. Over here, they have the 10th module, which is the skill birth attendant module, which is done in the 6th semester, and self-study, of course, which is carried on from the 1st semester. Again, over here, you can see a break semester. The candidate shall have cleared all the previous exam before appearing for the 6th semester. So, however, they can carry on with the subjects. They can go on with the subjects with the consecutive semesters. Next slide, Dr. Nalini. 7th semester, they have the community health nursing research and statistics, midwifery, obstetrics and gynecology, nursing 2. And over here, this is the last mandatory module the students will be undergoing, safe delivery app module. And then they have your self-study co-curricular and their community health nursing 2. Over here, in the 7th semester, students finish their complete course. So over here, it is a break semester again. Unless they clear all the subjects, they cannot go to the 8th semester, which is the internship. Till the 7th semester, they can carry on with their subjects, but they cannot write the exams. Over here, they have to complete the 7th semester. Otherwise, they will not go to the internship. As you all know, the course is 7 semesters. The 8th semester is exclusively internship. So unless they clear all the 7 semesters, they cannot do their internship. So the 8th semester is a community health nursing 4 weeks posting they have. Like I already told you, the whole 8th semester is internship. And then adult health nursing 6 weeks they have. Child health nursing 4 weeks, mental health nursing 4 weeks, and midwifery 4 weeks. And of course, just like our previous syllabus, all the 5 specialties evaluated and the marks will go to the mark sheets. So the candidate shall have cleared all the previous exam before appearing for the final exam. Just like our old syllabus. Next slide, please. Just like our old syllabus, the maximum period to complete the program successfully should not exceed 8 years. In our previous syllabus also, the same details were given. Over here also, we can the student can continue the course till the 8 years. So coming to the mandatory modules, there's some caption put on top. Every module, 1 credit is 20 hours. So make a note of it, 1 credit is 20 hours. So the modules, I've highlighted all the modules I'll be taking the courses. First aid is in the 1st semester, like we already saw, which was highlighted over there. Then health assessment in the 2nd semester, BCLS in the 3rd, foundation of prescribing is in the 4th. You have 2 mandatory modules in the 4th semester, and then you have 4 mandatory modules in the 5th, and 1 mandatory module in the 6th, and the last one in the 7th. So all the mandatory modules, with the help of the Tamil Nadu Nurses and Midwives Council, it will be there in the council website, where the students can complete these courses and get the credit points. Next slide, Doctor. And coming to the elective modules. Elective modules again, students need to complete the elective modules in the 4th semester, 6th semester and the 7th semester. They have to complete only 3 elective modules throughout the 8th semester. So make a note of it. Mandatory modules, there are 11 modules which they have to complete it. There's no other go. They have to complete it. But elective modules, there are 17 elective modules which is spread out throughout the 8 semesters, which should be taken in the 4th, 6th and 7th. So coming to the 4th semester module, again, every module, it is 20 hours with 1 credit. So 20 hours, 1 credit. So In the fourth semester, we have 3 modules, which are human values, diabetes care, and soft skill. So they can opt for any one of the module and complete it. So next slide. In the sixth semester, they have 9 elective modules, which is CBT, personality development, addiction psychiatry, adolescent health, sports health, accreditation and practice standards, developmental psychology, menopausal health, and health economics. Again, out of the 6 modules, the students have to complete one mandatory module, one module out of the 9 modules. This is again in the 6th semester. So 4th semester, 6th semester, and the last one is in the 7th semester. In the 7th semester, again, you have an option of 5 modules which are put by the INC, which is the scientific writing skills, lactation management, sexuality and health, stress management, job readiness, and employability in healthcare setting. So out of the 5, they can opt for one elective module and complete it in the 7th semester. So I hope it's clear to everybody. 11 mandatory modules which they have to complete, and 3 elective modules which they have to complete in the 4th semester, 6th semester, and the 7th semester. So coming to the credit points, briefly, I just like to highlight it. For every 1 credit hour of theory, it is 20 hours. And for lab, it is 40 hours. For clinical, it is 80 hours. For internship, that is in the 8th semester, 1 credit is again 80 hours. So this is the key for all the forthcoming sessions also. If you know this 1 credit, I mean 1 credit is how many hours, you'll be able to go on smoothly with the other sessions too. Next slide, Dr. Nalini. So practicum, again, I told you the 7th practicum for the 7th semesters, excluding internship. So they have skill lab simulation of 600 hours, that is 17% and clinical of 2,880 hours, which comes to 83%, with a total of 100%, which comes to 3,480 hours. Coming to the first semester to the 7th semester, there's a phrase which is put in the INC regulation, which says a maximum of 13%, that is 400 to 450 hours from the clinical hours can be used in the simulation lab for skill lab simulation learning, and not to exceed 30%, that is 864 hours out of the 3,936 hours. So few of the procedures which are not available in the clinicals can be done in the skill lab. That is the understanding of that particular statement. So where procedures are not available, or you cannot get certain procedures like CPR or different types of bandages, bowel wash, death care, these procedures which needs to be done in the clinical can be completed in the skill lab hours. So stipulated of 13% to 30 hours are given, 30% is given, where you can take some of the clinical hours and complete it in the skill labs. Next slide. So 8th semester, like I've already told you, it is complete internship of 1,056 hours, 12 credits, and they'll be going for 48 hours per week. So that goes to 22 weeks in 5 specialties, which I told you already. So a total of 6,336 hours will be covered throughout the 8 semesters with 100%. So the total credit points which are completed to get the BSc nursing degree program is 141 credits. Next slide, Dr. Nalini. And this is the cumulative of everything which is put out, including the self-study or the co-curriculum, which is included in each semesters. Next slide. So just to recap, the highlight of the program, it goes on for 4 years and 8 semester. From 1 to 7, you have all your subjects, and the 8th is only for internship. You have 11 mandatory modules and 17 elective modules, where the students can take it in the 4th, 6th, and 7th. Coming to the break semesters, the break semesters will be on the 4th, 6th, and 7th, where the students can continue their courses in the 4th and 6th but in the 7th, they cannot continue with the consecutive course unless they complete the 7 semesters. They cannot do their internship. So this is brief about the lecture. And just to review, one theory credit is 20 hours, one skill lab is 40, one practical is 80. This includes the internship also. So a small exercise, where you can just pen it down in your paper. How many courses are there in 4 years? Which are the break semesters? How many elective modules are available in the program? Which semester should be the electives to be completed? How many mandatory modules are there? How many hours are allotted for one elective credit? How many hours are allotted for one theory credit? How many hours are allotted for one lab clinical skill lab? Sorry. How many hours are allotted for one clinical credit? And the same goes on for the internship also. So if your answers are ready, I hope all have written the answers in a piece of paper. So we can go to the next slide to see the answers quickly. So you can see 30 courses, break semester 4, 6, and 7. Electives are 17. Semester which they have to complete is 4th, 6th, and 17th. The elective modules, mandatory is 11, 1 credit hours, a third 20 for theory. And even for elective, it is 20 only. Lab, it is 40. Clinical credit is 80. And in the internship also, it is 80. So with this brief introduction of our 4-year program, I would like to conclude by telling that time takes it all, whether you want it or not. It's time to change. See that you put down all these in a piece of paper and go through it again and again. The more you revise it, the more you will be thorough with your syllabus. So let's put our hands together to give the best nursing education to our students through the system. Thank you.
Thank you, Dr. Fabiola. That was a wonderful presentation. You gave a brief view on how the structure has been placed in the BSc curriculum with all the subjects and the mandatory modules and the elective modules. I would like to reinstate what Madam once again told about the mandatory modules. Remember, the mandatory modules are mandatory that the student has to complete, but there are no specified credit hours for the mandatory modules. The mandatory modules are inbuilt in the course itself. Okay, it is inbuilt in the course, and the credits for the mandatory module is inbuilt in the course or the subject. So there is no separate credits being allotted for the mandatory module, but for elective modules, it is there. Again, the mandatory module, it is available in so many websites, which will be discussed by our next expert. The elective modules are the one which has been proposed by the Registrar of Tamil Nadu Nurses Midwives Council, that these elective modules will again be placed in the website of Tamil Nadu Nurses and Midwives Council for students to complete. So we should really be thankful to our registrar for taking this effort to help us and coordinate with us to make the students complete the elective modules in a timely and a very specific manner. We will move on to the next presentation for the day. And if you have any questions, please do remember to put it in the chat box. We will take up the questions, and as you complete each session, you can type the questions in the chat box, so which will help us to collate all the questions later. Again, see to that, please you put on your videos and please put off your mics. The mic should be off, video should be on. So we now move on to the next presentation for the day. I invite Dr. Maragadam, who is going to be here to speak on the distribution of credits and hours across the semesters. So may we have Dr. Maragadam?
Thank you, Dr. Nalini. Very good morning.
I will just share your PowerPoint also, madam.
Yeah. Respected Registrar for taking such a wonderful initiation on planning, implementation, and even up to the transcript. And Dr. Nalini being a coordinator for your beautiful efforts, for the arrangements given now for sharing this PowerPoint, and the co-coordinators of the workshop, Dr. Shanta Ramesh and Dr. Sami, for your untiring efforts to organize these events, and all the experts who are and all the participants. Very long topic. So this discussion of credit hours across all semesters were covered by okay. Next slide, please.
Margadam ma'am, there's a lot of echo that is coming up.
So from my side, clear. I didn't get any echo.
Maybe someone in the same room would be using the link, ma'am. If anybody is there in the same room, no, they can go away, ma'am. You can avoid it.
Oh, I am in a separate room.
Okay.
Okay,
you.
now it's okay, ma'am.
Is it clear now?
Yes, ma'am. Now clear.
Thank you. Yeah, next slide. Yes, this BSc nursing program is a 4-year time, has 8 semesters. It adopts credit system and semester system. So the main objective of this particular presentation is to review the distribution of credits and hours for theory and practicum for the 8 semesters. So when we come to the credit hours, just it's very easy and simple to remember. 1 theory credit hours, that is equal to 1 hour per week. So if we see in the semester, we have 26 weeks in each semester. In that, 20 weeks are given for instructional hours, and we have holiday 1 week, and exam and preparation for 2 weeks, and vacation for 3 weeks. So instructional hours are 20 weeks per semester. So in the theory, if we give 1 hour per week, it denotes 20 hours per semester. So that's why it is given in the bracket. When we come to 1 credit elective course, again it is 1 hour per week, 20 hours per semester. Then coming to the practical or lab or skill lab or simulation lab, 2 hours of practical hour is equal to 1 credit. So we have in a semester 20 weeks, so 40 hours per semester consist of 1 credit. But when we come to clinical, 1 credit clinical is 4 hours per week. So we have 20 hours, 20 weeks, so 20 into 4, that gives you 80 hours per week. So these things are for the first semester to 7th semester. In 8th semester, only the change is instead of 20 hours per semester, we have to plan for 22 weeks in 8th semester. So the total hours here is 1056 hours, but clinical credits remains same. Next. So we'll go for semester wise, whichever is something new was highlighted there. So if you see, there is a course code that is given for each course by Indian Nursing Council. So this course code will be followed by all over the India. So we also need to follow this during our examination, and even in their mark sheet transcript, this will be printed already. So already we have a different course code. So it's up to the university to decide retaining both course codes like university course code or maybe INC course code, or they can have a decision of taking completely only INC course code, or any style they can follow. So that is something new here. And when we come to the each course, they have given theory credits separately, followed by laboratory credits, then for core nursing courses, clinical. So totally in this first semester, we have 20 theory credits, 2 lab credits and 2 clinical credits. But what is something new here is Nursing Foundation 1, that includes 1 mandatory module, that is first aid module. So you have to open and see if you have the modules printed. That will tell you how many hours of theory and practical is allotted for this first aid. So there is no separate hour. We have to keep it in our mind. The hours prescribed in the module hours also included in here theory, clinical and practical. So it's a combination of the both. So additionally, what we have extra self-study and co-curricular activities. So in this first semester, equally it is given 40 hours of self-study plus 40 hours of co-curricular. So total in this semester, we have 720 hours we need to plan minimum. Next semester, please. Next slide, please. Yeah, second semester. In the second semester also, again, the course code remains same. And here in Nursing Foundation 2, additional module is Health Assessment module. And study and co-curricular activity here, it is 40 plus 20. So the total hours. So per week, we have 40 hours. If we have 20 weeks, it will not exceed more than 800 hours. So we have to keep that also in our mind when we are planning our semester plan. Next, please. In third semester, we have, instead of, so far we used to call medical surgical nursing. Now there is a change in the name, adult health nursing. So adult health nursing 1, it has PCLS module here. So here self-study and co-curricular activity, we have only 20 hours. And in fourth semester, adult health nursing, fourth semester, please. Previous slide. Yeah, in fourth semester, we have palliative care module in adult health nursing 2, and in self-study and co-curricular activity, totally here 40 hours. And the total hour is within 800 only. Next, please. In fifth semester, in child health nursing 1, there are 4 modules mentioned here. So each one, what is the theory and practical and clinical hours are given separately in the module hours. If you see, when I have calculated for all the 4, it comes around 23 theory hours. So excluding from 60 hours, 23 minus will be for the child health nursing, pediatric nursing, complete theory hours. So likewise, you have to allot from clinical and practical. And a new course is introduced in semester, Introduction to Forensic Nursing and Indian Laws. This is the new course. This is 1 credit course for 20 hours. And then self-study and co-curricular activity here, 20 plus 20 hours. So again, still 800 hours planned for semester. In sixth semester, the modules for midwifery module is there. But if you note in self-study and co-curricular, no separate hours are allotted. Excluding that, already we have 800 hours. Next, please. In seventh semester, again, there is no extra and co-curricular activities. But already there is a separate team will talk to you about mandatory modules in detail. Already the previous presenter, Dr. Fabiola, also mentioned there is the mandatory elective modules already. There are 3 elective modules that will be included in 4th semester, 6th semester, and in 7th semester. So that when you listen to that module session, you will listen to that little elaborately. So in the 7th semester and 6th semester, there is no time allotted for self-study and co-curricular activity. Since all other courses, it is included 800 hours here already. Now, 8th semester, this is purely internship totally. So here the duration for each week is 48 hours. Duration of this semester is 22 weeks. So if you pay attention, all the semester specialty has 4 weeks, but adult health nursing is 6 weeks. So totally it has 22 weeks allotted. So per day 8 hours, Monday to Saturday. So total hours are 1056 hours distributed in 22 weeks. So distribution of credit hours by courses, internships and electives. We have total credit hours of the entire BSc nursing program is 156. So it includes course credit of theory 141. Then internship we have 12. Then for elective 3 modules that comprises of 3. So totally 156. There is a small difference in what is mentioned here is from some Saturdays, you can allot 5 hours for each week into 20 weeks for all the 7 semesters of self-study and co-curricular. It is mentioned But we have seen in the previous slides, it was hours was not allotted for sixth and seventh semester. So what we can plan is what is given in the table, we can just to follow because already we have 800 hours. And these two, like 12 and 35, something we need to decide. These are all not included in credit hours as such. So this is the actual essence of how the hours that is distributed in throughout this particular semesters. Again, it is based on the credits already what we have seen before. Total hours is also we have 156 hours. Here it is elective modules, including elective modules. We have 156. Then total hours for the entire program is 6336 hours. So percentage wise distribution also given for theory, clinical, and practicum. So total hours from the clinical hours, there was a saying 30% can be given in the laboratory. That means already from the distributed hour or allotted hour by INC, it carries 17%. So from the clinical hours, the curriculum planning committee can shift 13 hours to practical lab hours to demonstrate or get a demonstration of certain procedures where all the students may not get in the clinical area. Already the examples are given, presented before, like death care or even bone marrow aspiration, even for a child neonatal resuscitation. Many children may not get everybody. So those procedures we can take the risk and we make sure every student get equal chance of practicing in the lab. For that person, it can be used. So it should not exceed more than 30%. Additionally, together it comprises of only 30% of clinical and practical hours can be conducted in the laboratory. So it is not a must that everybody has to do all this 30%. What is, we can keep it in mind, some institution where you have inpatients are so good, your patients availability is more, you may not go for all the procedures. So this can be upper limit is 30. So some institution may require only 20 or 25. So it varies institutions to institution. The guideline is maximum 30%. That's all. Yeah, so that is the essence of this presentation. So what we have seen so far is there is a course code. We should remember and reflect in every planning and for credit system, 1 theory hour equal to 1 hour of classroom instruction and 1 credit of practical hour is 2 hours of laboratory classroom instruction demonstration and clinical means 1 credit is equal to 4 hours of clinical experience. And in modules, you have mandatory modules. Mandatory modules are incorporated along with all the course, the core nursing syllabus. And in that, the hours included with the same course itself. There is no separate hours. How much need to be allotted is given in the modules. For elective modules, optionals are given, and each one, any one will be taken by the particular student. So options are there as per the interest, they can choose it. That is distributed in 4th semester, 6th semester, and 7th semester. And we are following from annual system to semester system. It comprises of 7 semesters of theory, practical, and clinical. And the final semester has purely internship of complete clinical practicum with the 22 weeks followed by a practical examination of all the specialty. So that's all about the presentation. If you have any doubt, you can ask. We have given actually a activity session for the group to make timetable. So in the timetable, what I would like to stress you here is mention the course code and how many credits each week we are completing. We can mention it for the particular week and cumulatively also you can mention it so that at the end of 20 weeks when we check, we should make sure as per the INC recommendation whether we have completed all the critical hours or not. So that will be very useful. And second activity, we have given them to identify the procedures. So that's all about this particular. So thank you for given opportunity.
ஒரு
Put
மெசேஜ்
your doubts in your,
நான்
yeah.
Thank you, Maragadam ma'am. Once
Thank
again, a gentle reminder to all of you, please mute your mics. To respect the expert resource person, they've taken time to share with you all the important aspects of the nursing curriculum. So I think we should respect the presentation and we should respect the speaker for the efforts taken. Mute your mics, please, and put on your videos. Thank you, madam. So that was a very nice recap of the credit hours that has been allotted in various semesters. Now we can move on to the next session. Again, we have a gentle reminder. In case you have any questions, do type it in the chat box without fail. As the session ends, you can just put it in the chat box. Now we move on to the next session, which will be dealt by Dr. Hepzibah Sherman. She's going to review the courses which is there from 1 to 4 semesters. I'm sorry. It is Dr. Anita Rajendra Babu who's going to review the courses from 1 to 4 semester and the related transcript for those aspects. May I have Dr. Anita Rajendra Babu, please?
Yes, I am here. Good morning to everyone. Shall I start sharing the screen?
Yes, ma'am, please.
Will you able to see?
Yes, ma'am, it is visible. It's
Okay,
completely visible.
okay.
Thank you.
Good morning. Good morning to one and all present here. Thank you to our inspiring leader, Dr. Annie Grace Kalaimadi Aridista ma'am, to bringing this virtual platform for all the nursing teachers to know about what are the changes in a curriculum. So I think it's a great platform for us, and I thank all the organizers, especially Dr. Nalini for organizing for more than 10 days. And you're doing a very good work. So I'll start with my okay. So today we are going to see about, like, till now our students were studying year exams. Now INC has changed, revised a BSc nursing curriculum implementation. Like today I'm going to talk from first semester to the fourth semester. So like what are the subjects we are going? First year we studied anatomy, physiology. Second, like it is the old one, anatomy, physiology, nutrition, biochemistry, nursing foundation, psychology, microbiology, and English, and introduction to computer. But in the revised, it is in the first semester, they are studying communicative English, applied anatomy and physiology, applied sociology and psychology is included in the first semester. Before, the students were writing sociology separate paper and psychology separate paper, but now they had put together applied sociology and applied psychology and nursing foundation 1. So communicative English will be the internal paper in the first semester, and nursing foundation 1 will be internal, theory and practical will be in first semester. Only 2 papers they will be writing in first semester. In the second semester, they write applied biochemistry and applied nutrition and dietetics. This time they have added dietetics and nursing foundation 2. That here they'll write theory and practical exam as university exams. And the newly added subject is health nursing informatics. It is an internal theory paper. It is a newly added subject in the second semester. Then in the theory, same thing they told, 20 hours 1 credit, elective modules 20 hours per module 1 credit, clinical 80 hours 1 credit, skill lab 40 hours 1 credit. Till now they were telling this only. This we have to keep it repeatedly. Why we are telling us we have to keep it in our, we have to register this. So this is the old, and I have told you about each subject I am telling. what are the things has been included in this paper. So here in the English, it was in the first year, it had 60 hours, but the hours has been reduced 40 hours in the revised semester pattern. It is an internal theory paper. Here, what are the newly added topics? Communication, introduction of listening, speaking, reading, grammar, writing. So this is been included. Then attentive listening, then speaking, effective communication. So these are the newly added topics in the English. Again, reading. In the reading, they have given reading notes, messages like that. Writing skills. Here they have added paper writing skill like abstract. Again, they come to LSRW skills. That is learning, speaking, reading and writing. So this is about English. In applied anatomy and applied physiology, in the first year, we had 60 hours, same thing. Here also, they are studying for 60 hours and 60 hours, but they are writing the theory examination in the first semester. So newly added topic in applied anatomy, the circulatory and lymphatic system, the musculoskeletal system, respiratory system, digestive system, circulatory and lymphatic system, blood, the sensory organs, musculoskeletal system, nervous system. So these are the topics newly added in the applied physiology and applied anatomy. So when you come to applied sociology and applied psychology, before they wrote in the second year, they wrote a sociology, they had a 60 hours. It was in the second year theory paper, sociology, and psychology was in the first year. But now in the revised semester, they have brought it in the first semester, they write together. So applied sociology and applied psychology, the same hours of theory and practical, but together they will write as a university examination. So what are the newly added topic to the sociology? Social structure they have added, social organization and disorganization, clinical sociology is being added. Then when you come to psychology, here they have added introduction, developmental psychology is being added, application of soft skills, then self-empowerment. So this has been added in the psychology and sociology. Now when we are coming to the nursing foundation, that is in the second, it is in the first semester and the second semester. Before, the nursing foundation was in the first year, but they have divided and given in first semester and the second semester. First semester, they have to study 120 hours of theory, and the second semester also they have to study 120 hours of theory. When you come to practicum, first semester they have to do 160 hours, and in the second semester 320 hours. And skill lab, it is 80 hours in the first semester and 120 hours in the second semester. So together they will be writing a university exam in the second semester of theory and practical. So what are the changes they have brought in Nursing Foundation 1? Here they have given promoting safety in healthcare environment has been added, newly added topic, that is fall risk assessment. When you see about Nursing Foundation 1, what are the newly first aid? Here first aid, they have added wounds, hemorrhage, shock, musculoskeletal injuries, and other new added topics has been added, and elimination needs and care of terminally ill patients. And concepts of cultural diversity and spirituality has been added in Nursing Foundation 2. So then we come to nutrition and biochemistry. Here in the revised, we call, here they say applied nutrition and dietetics. Dietetics we were studying in the third year in the medical surgical nursing 2 in the old syllabus, but they have added dietetics here in the first like in the second semester itself. So together they will be writing applied nutrition and dietetics and applied biochemistry. Before, nutrition was 60 hours. In revised also it is 60 hours. But 10 hours has been increased in applied biochemistry. That is 40 hours has been increased. So second semester, they will be writing the university theory exams. Here, what are the newly added topic is clinical enzymology, acid-base balance, heme catabolism, organ function test. In applied biochemistry, these are the newly added content. So in applied nutrition and dietetics, they have added balanced diet, nutritional deficiency disorders, therapeutic diet, nutritional assessment and nutrition education, national nutritional program and role of a nurse, food safety, nutritional deficiency disorders. This is all our new units, newly added content in the diet, in the nutrition subject, applied nutrition and therapeutic diet. Here again, they have added nutritional assessment and nutrition education, food safety. Then the course which is not here is health informatics, including safety. That is including safety. Here, this is a new subject. This is in the second semester. You have here 40 hours and practicum is 40 hours. This is an internal paper. Health, nursing, informatics, newly added subject. Here then we come to the microbiology. Here microbiology, the students were writing in the first year. It has come to the third semester. Here applied microbiology, infection control, including safety. So when you are studying here same 60 hours, but 40 hours has been given for applied microbiology. It is given as section A, and section B is infection control including safety, that is 20 hours. Here skill lab is 20 hours for applied microbiology and 20 hours for infection control including safety. This they will be writing in the third semester theory paper as a university exam. There is no change in the old content. There is no added any new topics or anything in the microbiology. And this is not in the infection control. I told you before itself, it is added new topic in the microbiology. Then we come to the pharmacology 1 and 2. Before the students were writing only pharmacology 1 paper. It was 40 hours. But here they write for the pharmacology 1 we have in the third semester, and pharmacology including fundamental of prescribing module, they will be in the fourth semester. So in the third semester, they will have 20 hours of theory and 60 hours of fundamental of prescribing module in the fourth semester. So in the fourth semester, they will be writing. So what are the changes? Newly added topic is drugs used to treat serious and blood disorders. Drug, that is 5th unit. 7th unit, drugs used in treatment of integumentary system. Drugs used in treatment of communicable disease. Drugs used in ENT eye disorders. Drugs used in urinary system. Drugs acting on nervous system. Drugs used for pregnant women during antenatal, labor and postnatal period. Miscellaneous. Fundamental principles of prescribing. This is a fundamental principles of prescribing is the new unit module. So when you compare about pathology, genetics, pathology, we are studying third semester 20 hours and fourth semester it is 10 hours. And genetics, it is 10 hours. Genetics, it is being reduced before it was 15 hours. Now it is being reduced. So pathology and pathology 1 and 2, it is 20 and 10. So what are the newly added topic is special pathology. Here they have added gastrointestinal tract, oral mucosa, hematological test for the diagnostic blood disorders, special pathology. So these are the newly added content for the pathology 1 and 2. So when you see about genetics, there is no change from the previous syllabus. So when you are coming about adult health nursing 1. Adult health nursing 1, they studied, it was medical surgical nursing. Now it is changed into adult health nursing 1 with integrated pathophysiology, including BCLS module. So the student it is placed in the third semester. Here the theory is 140 hours. Before it was 210 hours. Now it has been reduced to 140 hours. And practical, it is 720 hours. Here the practical is 480 hours with 6 credits. And the examination, they will be writing the theory in the third semester, theory and practical. So it is changed, the name is changed from medical surgical nursing 1 to adult health nursing 1 with integrated pathology, including BCLS module. Here, what are the newly added content is here wound care and dressing, that is introduction, nursing management of patients with disorders of digestive system, nursing management of patients with cardiovascular problems, nursing management of patients with communicable disease. So these are the newly adult health nursing topics have been added. When you are coming to adult health nursing 2, here before it was called as medical surgical nursing 2, now it is called adult health nursing 2 with integrated pathophysiology, including geriatric nursing and palliative care module. Here it is placed in the 4th semester. Here the theory hours has been increased. Before the student was studying 120 hours. Now it is increased to 140 hours. Practical again, it is increased from 270 hours to 480 hours. Examination, they will be writing in the 4th semester, theory and practical. Before the student were writing their exams in the 3rd year. Here, the newly added content in adult health nursing is nursing management of patient in critical care unit. Here they have said like breaking bad news to the patients and or to the families, communication with patient and family. So nursing management of patients with kidney and urinary problem, nursing management of patients with male reproductive system. These units are shifted from medical surgical nursing 1 to adult health nursing 2 in the 4th semester. Like nursing management of patient with kidney and urinary problems and patient with male reproductive system, nursing management of patient with immunological problems. So before the students were studying medical surgical nursing 1, now it is shifted to medical surgical nursing 2. So then nursing management of patients with disorders of female reproductive system. This unit shifted from medical surgical nursing 2 to midwifery, and like they will be studying in OBG. Nursing 2 in the semester 7. So these are the changes has been done, and the another new course has been included is professionalism professional values, ethics, and bioethics. This is an internal paper in the 4th semester. It is a theory paper. It is 20 hours. Placement is 4th semester. So first semester, Nursing Foundation 1, they have added modules. These are the modules, 40 hours per module equal to 1 credit. So first day, in the second semester, they will be writing, they'll be doing the health assessment. And the third semester, BCLS. Fourth semester, adult health nursing, pharmacology 2, fundamentals of prescribing under pharmacology, palliative care module. So these are the elective modules: human values, diabetes care, and soft skills, third and fourth semester. So this, as ma'am told, it will be in a nursing, Tamil Nadu Nurses and Midwives Council. The students, they can go log in and they can do. So it is easy for us. So ma'am has done an easy job for us. We don't want to take one, if we are going to give it, we'll be giving only soft skills or diabetic care, human values. But each student will be having their different area of interest in doing this, doing this modules, selective modules. So to help us, our registrar madam is going to do it on the council website. So the student can go anytime and they can go and attend it and they will get a certificate. Okay. So these are the educational technologies. Like we have a supervised clinical practice research project. We take student for field visit, presentation, everything. We do practice session, simulation, we do role play, demonstration, we do case presentation in the clinical area, self-directed learning, case analysis, discussion. So these are the things we do, and we do workshops. So when you see about the educational technologies, what is reflective learning? It is a form of education in which the students reflect upon the learning experience, which improve reading, comprehension, writing performance, and self-esteem by a self-examination. And relationship-based education, the teacher reflexive about place in a given context and receptive to the lived realities of the students. And exponential learning, the process of energized learning that leads to a desire to learn more about a given subject. Experiential learning, it is a process of learning through experience and learning through reflection on doing. Hands-on learning, like where we put our students in the clinical area, that they learn hands-on learning. So artificial intelligence, it is a simulation of human intelligence processed by machines, especially by computer system. Machine learning, it is a form of artificial intelligence that learns the relationship between data without the need to define them a priority. So there is no change in the procedure logbook. It is arranged like in system wise. And about this is about the transcript. We have prepared in the first to fourth semester, like how it has to come, and it will be first to 8th semester together. It will be printed and it will be done. So here the college logo, name of the thing, for all Tamil Nadu nursing colleges will be having the same transcript. So till now, each college was giving one transcript. So our registrar madam has a plan to give a transcript. So this is a format how they'll be modifying it. But here we have planned a micro transcript. So what will be done, and it will be given to all the colleges after doing everything. So this is a sample what we have done it for the first semester to fourth semester. This all will be put together and it will be made in a single paper. So college logo, name of the college, affiliated university name and address, Tamil Nadu, like that. Then here 4 years course, then 4 years, then college address, everything will be there. Name of the address, year of study, name of university, date of birth, degree duration, date of admission, date of completion of the course, university registration number, contact and character. So this in the first semester, it is communication English, prescribed attendance this, and based on this heading we have done it. Still there will be changes will be made and it will be circulated to all the colleges. So this is for the second semester and this is for the third semester. We have added even the attendance, credit point, whatever the maximum marks. So everything has been added. Thank you. So if you think something can be added, because many senior persons will be there, if you think that you can add something in the transcript, you can you can tell us. You can chat, you can put it in the chat box so that it will be easy for us to add. Thank you all. Thank you for listening.
Thank you, Anita ma'am, for reviewing those semesters from 1 to 4. You had clearly brought out what are the inclusions and what are the exclusions, and those important features that people have to take care when they are taking care of 1 to 4 semester. May I request members to mute their mic? I can hear some hot voices going on there. Can members please mute your mic? Jennifer Justina. Ms. Jennifer Justina, please mute your mic. Thank you. I request once again, members who are there, please see to that your mics are muted and your videos are on, so that we are able to view your activity on the other side. Now with 1 to 4 semesters getting over, now we will move on to the next 4 semesters, that is from 5 to 8. And we have Dr. Hepzibah Sherman to show us an overview of all these 4 semesters. Dr. Hepzibah Sherman is the principal of Chettinad College of Nursing. May I invite you, ma'am, to take over the
Thank you. Yes, thank you. Try and leave this world a little better place than you found it. I acknowledge our high profile Tamil Nadu. Able to hear?
Yeah, you can just put your presentation on a PowerPoint mode.
It is, are you able to see?
No, it's not in a PowerPoint mode actually.
You're able to see my screen, ma'am?
Yeah, we are able to view your screen, but it is not in PPT.
How about now? PowerPoint mode?
No, not yet.
Not yet. It's in the PowerPoint mode only. So this is the PowerPoint mode. This is the PowerPoint mode. In my screen, it's on the PowerPoint mode.
Okay, no issues. I will just share the PowerPoint if you want. Can I do that for you?
Let me do it, ma'am. Just give me a second.
Yeah, please.
PowerPoint mode.
You just close once again and you can come in.
Okay. It's in the PowerPoint mode. Close and then start again.
A gentle reminder again to put your questions in the chat box. I can see so many questions that are coming up more on implementation aspects. So that's nice to see people are really interested to, execute this curriculum.
Good, ma'am.
Yeah, that's fine, Dr. Hepsi.
Yeah, thank you, thank you. Try and Dr.
Ms. Devi, please mute your mic, please. Ms. Devi from Bond Softwares. Please unmute. Thank you.
Thank you.
Sorry, Dr. Hetzi, please go on.
That's okay, ma'am. We would like to acknowledge the Tamil Nadu Nursing Council Registrar, Dr. Annie Grace Madam, for her expertise and time in crafting nursing education a lot better. Now, how can we implement semester 5 to final year? Here we go to see in depth. Next slide. So in our presentation, we'll be seeing about the changes, what happened in the 5th to 8th semester, review the educational technologies that we are supposed to use, and prepare the logbook and transcript for the end semester. If we could compare and contrast the 5th and 6th semester, we have got Child Health Nursing 1 and 2, Mental Health Nursing 1 and 2, Community Health Nursing in 5th, Education Technology, and Introduction to Forensic Nursing and Indian Laws. In the 5th semester, we will be having one theory and practical of Community Health Nursing, Education Technology and Forensic Nursing theory exams. In semester 6, we will be looking at Child Health Nursing 2, Mental Health Nursing 2, Nursing Management and Leadership, and Midwifery and Obstetrics. However, no examination in 7th semester and 3 university examination of theory and practical in Mental Health and Child Health Nursing. In the 7th and 8th semester, we have got Community Health Nursing 2, Nursing Research and Statistics, and OBG. Here we have got all 3 subject theory and practical, and in internship in the comments in the 8th semester, we only have the competency assessment, which will be there for 100 marks. Over to the allotment of hours in each semester, we have got 5th and 6th semester of Child Health Nursing having 60 and 40 hours each with 3 and 2 credit hours. Clinicals, we have to post them in laboratory education as well as along with the clinical practice of 2 + 1 credit and 80 hours in Child Health Nursing practicals. Internship, if we could compare, we have to provide them 192 hours of internship hours, which will be of 4 weeks. And of course, they'll be writing their university exam, theory and practical in their 6th semester. Certain newly added topics in child health nursing would be the modern concepts in child care. In the unit 2, nursing care of neonate is been added, and we have to teach them about the equipments, nursing management, and other disease condition which you can observe. COVID-19 is also a new chapter which has been added in unit 3. In comparing the mental health nursing, we have got mental health nursing in 5th and 6th semester of 60 and 40 hours respectively, and clinicals of 80 and 160 hours. And in internship, we have to provide them 4 weeks of internship training. And they will be writing their examination in their 6th semester. Certain newly added topics are the principles and concepts of mental health nursing has been added, and these are the subdivided added topics. In unit 1 and 3, nursing, mental health nursing has been added. Nursing management of patient with substance abuse was very, very important for now, including the MET and refusal to seek and special consideration of vulnerable population. We often forget them with being marginalized. So those things we have to teach them. In the 3rd unit, we have added nursing management of behavioral emotional disorders occurring during the childhood and adolescence, particularly learning disorder has been added. In community health nursing 1 and 2, it falls in 5th and 7th semester. This was highlighted by the previous speakers. 5th and 6th, 7th semester has got community health nursing. So in between semester do not have any community exposure. 100 hours of each and 160 hours of each in the clinicals. And internship, we have to post them for 4 weeks. The university exam will fall on the 5th and 7th semester. The newly added topics in community health nursing 1 would be nutritional assessment in nutrition education, communication management and health education, communicable disease and national health program, in particular to COVID-19. In community health nursing 2, we have got reproductive, maternal, newborn, child and adolescent health added unit, with all these subunits been added. Leadership, supervision and monitoring has been added on the aspects of health team management, financial management, disaster management, particularly have added the disaster tribes, preparedness, the basic disaster supply kit and the disaster management module is also added in there. While looking at the education technology, which falls on the 5th semester, we have got 40 hours of theory and clinical respectively, and their university exam will be in the 5th semester. The added units are in 1st, 3rd, 4th, and 5th. And the introduction and the theoretical foundation, implementation, teaching in clinical setting, education and teaching media. These have been added as along with non-projected and projected education technology. Journaling is one important thing which has been added, and we have to promote journaling and diary making, which is very important. And certain other topics in 6th, 7th and 8th semester are assessment and evaluation methods, guidance or academic advising, counseling and discipline, ethics and evidence-based teaching. And the one new budded subject in the revised syllabus, which falls on the 5th semester, would be Introduction to Forensic Nursing, which will have theory of 20 hours, no practicals, and they have to sit for the university exam on their 5th semester. In particularly with the nursing management, they have got it in 6th semester, 60 and 80 hours of experience in theory and clinical, and examination will fall in the 6th semester. So the newly added topics are added in 1st, 2nd, 3rd and 5th on healthcare, nursing informatics, personal management and professional consideration has been added. Especially in midwifery and obstetrics and gynecologic nursing 1 and 2, we have got it in the 6th and the 7th semester of 60 hours each. Clinicals, they have to go in for 240 hours in the clinicals, 40 hours, especially in the lab simulation. And midwifery 2 will comprise of 320 hours and plus 40 hours in the laboratory. And the internship, in addition, we have to give them 4 weeks of experience in the internship, which falls in the 8th semester. In the 7th semester, they have to sit for theory and practical examination. Certain newly added topics are in 1st and 3rd unit on introduction midwifery, including maternal death audit is very important when they learn about the data management system, and midwives-led care units, which will make them to practice midwifery in a very clinical way. And in the assessment management of normal delivery, they learn how to build a partnership with the women from RMC. In the 6th and the 7th semester, they will be learning on the assessment and ongoing care of normal neonate, respectful newborn care and communication is what been added, and family welfare services, the impact of early and frequent childbearing and other subtopics have been added. In midwifery 2, recognition and management of problems during pregnancy. In that, they have added COVID-19 pregnancy in childbirth. In the 4th unit, in assessment management of high-risk newborn, the home-based newborn care problem and community facility integrated newborn care and bereavement counseling has been added. In assessment and management of women and gynecological nursing, this unit has been shifted from MSN 2 to midwifery. Assessment of management of women with gynecological disorder. So now coming to the research and statistics, which is falling on the 7th semester, they have got 40 hours of theory and 80 hours of clinicals, and they have to sit for the exam in the 7th semester. The newly added topics are evidence-based nursing in the 1st semester, writing hypothesis, very important for them to prove whether the research is true or not, is on the 2nd semester. Sampling and data collection, they have added research ethics, which is often missed, and council has taken so much of effort in giving lots of online program, and in Indian Nursing Council has also added that. And in the final meanings unit, they have added communication and utilization of research, which will take them into publication ethics and talk about the conducting group research project. So in the 5th semester, just looking at the mandate module, we have got 40 hours per module, which will have 1 credit hour. So in the 5th semester, we have got 3 mandate module. And in the 6th and the 7th semester, we've got 2 mandate module. And in the 8th, the final semester, there is no mandate module. There are certain elective modules, as speakers have been saying. Tamil Nadu Nursing Council will be uploading in the website for the students on free for them to learn. There are around 9 elective modules in the 5th and the 7th semester, and 5 elective modules in the 7th and the 8th semester. We have got enormous education technology, which we have to incorporate. And we suggest that let's use all these recommended education technology modules. And if you can add more, that will always be better. While now looking on to the logbook, in the logbook, the pediatric vital signs is missing. So we recommend to add on that. And in the community health nursing, MLHP logbook has not also been added in the community health nursing logbook. So this is a little recommendation given across. Observation in the field visit, we have Indian Nursing Council very clearly says for each semester, we are supposed to take them for a day of observation visit, as you say, from Anganwadi Child Clinic to Nursing Education Institution in the 5th semester, and 4 different places for them to visit in the 7th semester, and in the 6th semester and the 7th semester, it ends with healthcare delivery system, waste management, infertility clinic, and ART centers. So these are there for them to visit during their period of time in the studies. Coming over to the transcript. Transcript, we have suggested to divide it into student profile, record of theory and practice, clinical facility, observational visit, and record of clinical experience will be projected. And this, on recommendation of Tamil Nadu Nursing Council, all colleges will be implementing and using it the same. Now, breaking down into micro transcript. How are we going to deliver each week's of experience for the students to gain their expertise in child nursing? Indian Nursing has clearly given us the number of the wards that we have to give them. So in the pediatric health nursing, overall, in the 5th semester, 7th semester, and in the final year internship, it happens. So then the pediatric medical ward, surgical, OPD of each 2 weeks and 1 week, and the 7th semester, each area 1 week of 1 credit, and in child nursing, which falls in the 8th semester, we have to post them in all the areas, especially medical, surgical, OPD, NICU and PSU of 1 week each. So that will have a total of 2. So overall in BSc nursing, our students will be having 12 weeks of pediatric experience, which will comprise of 432 hours, gaining 5 credits. Coming on to the mental health nursing experience, we have to post them in the pediatric OPD and the insert inpatient wards of 1 and 2 weeks respectively. And they get a credit of 1. And in the 6th semester, we have to post them in bit more in OPD, inpatient, child guidance, community psychiatry, and de-addiction center of 2 and 1 week each. Then in the internship, we again post them in all these specified areas of 1 week each. having a credit of 2. So overall in the BSc nursing, we will be posting them in the mental health nursing experience of 12 weeks, which will comprise of 432 hours, gaining 5 credits. Coming back to the community health nursing, we have to post them in the urban and rural health centers, 2 weeks each, 40 hours, and which will have a credit of 2. And in the 7th semester, again, rural and urban, 2 weeks specifically, and in the internship, again, 2 weeks specifically, which will cover of 12 weeks, 512 hours, and they will be gaining a credit of 6 hours. Nursing management and leadership, they recommend us to post them in 1 week in the college and 1 week in the hospital, credit of 40 hours each. And very important thing, midwifery and obstetrics and gynecology, 1, we have to post them for 6 weeks. And in the 7th semester, we have to post them for 8 weeks in antenatal, infertility, labor, postnatal, neonatal intensive care unit, obstetric OT, and gynecological ward of 40 hours each. So that gives us to 4 credit hours. Looking back to the internship, we have got 192 hours, which means 1 week in each ward has to be, we have to post them. So overall, our students will be gaining 18 weeks of experience in the OBG ward with 752 hours of experience, gaining 9 hours of credit. Especially more than 4 hours of given experience in all other 4 areas, we have to, in addition, give 6 weeks of adult health nursing experience, and students will gain 3 hours of credit. So each of the ward, we have to post them at least minimum of 1 week. Overall, if you just want to see how the semester 8 will be looking as is, we have to give them adult health nursing 6 weeks, community health nursing 4 weeks, child health nursing 4 weeks, mental health nursing 4 weeks, and midwifery 4 weeks. So overall, our students will gain 22 weeks of experience in their internship posting and gaining 12 hours of credit hours. So with this, I would like to thank the core committee members and for the patient listening of all the participants. Thank you.
Thank you, Dr. Hepsi. That micro transcript that you had prepared and you have made others to visualize and made them sensitized with that was an important task. I hope all of you understand this micro system that has been brought in, which very, very clearly indicates the number of weeks that we post our students and the split up of credits for that particular weeks that we post our students. So we have to be very, very careful when we are giving credits for the hours posted in the clinical area. There should not be any discrepancy as the number of credits has been fixed for the clinical areas. We cannot give something beyond what has been stipulated by the council. So with this, we will move on to the next session. Again, certain reminders. There is a lot of questions that is coming up in the chat box. I can see all of them are related to the implementation aspect. In case you have any further queries or clarifications or something that you can add, please do post it in the chat box. Again, please do mute your mics and keep your videos on so that we are able to see your faces. We'll move on to the next presentation for the day. We have the next presenter, Dr. Prema Shekhar, who will be telling us about the list of mandatory and the elective modules, where to access these modules, because all of you would be wondering places where they can access the mandatory modules specifically. So now Dr. Prema Shekhar is here to tell us more about the mandatory and the elective modules. May I have Dr. Prema Shekhar on board, please? Prema ma'am, are you there? Prema ma'am, do you have some problem? Are you there already? If Dr. Prema Shekhar is not able to join, I think we will move on to the next. Yeah, she's there already. Thank you. You're there.
Ma'am.
Yeah,
Yeah, ma'am.
Can you share your
Can
slide?
you hear?
Yeah.
Yes, madam.
As Madam Prema Shekhar is just trying to open a PowerPoint, I have one more request to all of you. See to that your RM number is with you. You will be asked to enter your RM number in the feedback forms. So keep your RM number ready in a bit of paper so that you can add in the feedback form. Prema ma'am, put on your video.
Yeah, madam. 1 minute, 1 minute. What happened?
You want me to share your screen, ma'am? If you're finding it difficult, can I do that for you?
Yes, madam. Please.
Sure. You just come out, stop sharing so that I will be able to do that. Prema ma'am, you have to come out of your screen. I'm not able to share. Is that visible? Prema ma'am, is that visible for you? Prema ma'am?
இவங்கதான் சொல்றாங்க mandatory and elective moment.
Good afternoon to everyone.
Mandatory நான் சொல்ல போறாங்க போது அவங்க elective சொல்லுவாங்க.
Miss Lakshmi Padma, kindly unmute your mic. Mute your mic, please. Your voice is audible. Miss Lakshmi Padma, please mute your mic. Thank you. Yes, ma'am. Please proceed.
Ma'am, I'm audible, ma'am.
Yeah, you're audible, ma'am.
Yes. Sorry for the inconvenience. First of all, at the outset, I will thank our registrar ma'am who has taken initiative to aware about this newly curriculum given by our Indian Nursing Council, and also all the co-chairs and chairperson, especially Nalini ma'am, who was coordinate with all the expert and already taken for principals and vice principal is over, and now it's for all the nursing fraternity. It's going on virtual webinar. Thanks for Nalini ma'am. So my topic is incorporation of mandatory and elective module. So the learning objective of this is list the mandatory and elective modules, recognize the resource offered to students for learning mandatory and elective modules. So in the revised curriculum, already all the expert has spoken about this mandatory and elective module. So altogether it is around 28 module. In that 11 are mandatory module and 17 are elective modules. So mandatory module, both the modules are both mandatory and elective shall be certified by the institution or by the external agency. Mandatory module is integrated throughout the course, and for some of the mandatory module, INC has prepared booklets like for health assessment, fundamental of prescribing, and some of the modules, it is as per the standard guidelines, modules are available in the for first aid, that is by the National Red Cross Society, IMNCA, Essential Newborn Care, and FBNBC, Palliative Care, Safe Delivery App, and SBA module. And this has been given as a separate learning resource package. For us, a BCLS and a PCL, standard national and international module can be used for the Whereas for the elective modules, so totally there are around 17 elective modules, out of which 3 modules the student has to complete, and every module which is equal to 1 credit, that is of 20 hours. So let us see about the mandatory module. So the first one under the mandatory module is a first aid. It is integrated as a part of nursing foundation course, and it's the placement in the first semester, totally 20 hours for theory and 20 hours for practical. There are around 5 units. And if we see the resource, learning resource, yeah, this is the first 3 resources which is given by the Indian Nursing Council, and whereas the last one, so if you click this link directly, you can access the booklet which is available in the website. This is a standard manual which is prepared by the Indian Red Cross Society. Next please, ma'am. Coming to the next module.
Prema ma'am. Prema ma'am, are you there? We lost your connection.
It was muted, ma'am. She muted herself.
Yeah. Prema ma'am, can you unmute yourself? You're not audible.
Yes, now it's audible, ma'am.
Yes, please.
Can you hear me?
Yeah, We are able to hear you.
Yes.
Please proceed.
Yes, madam. So the next module is health assessment as a part of Nursing Foundation 2 course. The placement is in second semester. So for this theory 20 hours and practical skill lab 20 hours, there are around 3 units. And for this, the learning resource is given by our Indian Nursing Council. Ma'am, please next slide. So health assessment module prepared by Indian Nursing Council, and if you see the rest of the 2 things module, the bug instructor.com. So here the students can register themselves and they have complete this module. They may be get the certificate. Next, please, ma'am. So third one is BLS, BCLS as a part of Adult Health Nursing 1 course. The placement is in third semester. So here the theory is 4 hours, which is self-learning and lecture, and practical is 6 hours, which includes demonstration, practice, and ASCII. So this is as per the international and Indian guidelines. The booklets are available. Next, please, ma'am. So this is the thing again. So if you go via this link, we can register ourselves and the students can do the courses. Next, please, ma'am. So fourth one, fundamental of prescribing. This is a pharmacology 2 in the 4th semester. Here, if you see, it's only theory 20 hours and few hours for practice, and this can be planned in the skill lab or in simulation. So there are around 4 units. And for this, the learning resource, which is given by Indian Nursing Council, the fundamental of prescribing module, it is available in Indian Nursing Council website. And these are the links which we can directly access the resources. Next, please, ma'am. Next, fifth one, palliative care. This is integrated with adult health nursing 2. The placement is the 4th semester. And for this 15 hours theory and 5 hours practical, there are around 5 modules. Please, ma'am, next one. So this is the one which the Indian Nursing Council has given the resource as a reference. And this is the one that Trivandrum module, which is as a booklet available. Next, please. And this is the direct link. And 6th and the 7th one, see, together in 5th semester, the students will be doing 2 modules, that is FBNBC and ENBC in Child Health Nursing 1. So theory and skill lab is 18 hours and clinical is 5 hours. So there are around 8 units. So just if you see here, it is around 25 plus 18, which is around 43 hours. Please, ma'am, next. So the Indian Nursing Council has given the resource by means of National Guidance, Ministry of Health and Family Welfare, and a few resources are directly, we can go to the link which is given by our Indian which is given by the facility, given for the facility-based newborn care. Next, please, ma'am. Yes, this is for IMNCI. So this is phased in 4th semester again. So theory is 10 hours, clinical is 25 hours. So already in the old syllabus, IMNCA, it is there in the syllabus. So it is easy for us. We can see the resources. Identify the resource. So there are around 6 units. Please, ma'am, next one. So this is the resource given by WHO, by IMNCA, and by the NHM government.in. So these are all, it's about the IMNCA. Next, ma'am. Booklet is available. coming to the PLS, Child Health Nursing 1. So this is phased in 5. So if you see in pediatrics, that is in child health nursing, this is a few numerous modules are available. The last one is PLS, that is 5th semester. There are theory 3 hours, skill lab is 4 hours, and for clinical it is 10 hours. So here the learning resource, the national guidelines, MOH, Family, Ministry of Health and Family Welfare, and American Health Association guidelines is available. And also our IAP India is also given guidelines, and these have the link as well as booklets are available. Next please, ma'am. And 10th and 11th, so both the module, this has to be completed, integrated in midwifery, that is obstetric and gynecological nursing 1. So placement is in 6th and 7th semester. So this theory, skill lab and clinical hours are integrated in midwifery, obstetric and gynec 1 and 2 courses. And for SBA, there is a handbook is available. And another one resource, that Dakshka 2015 national guidelines and safe delivery app, that is given by Maternity Foundation of India and Indian Nursing Council. So these SBA and safe delivery app, so completion of both module is mandatory before the end of 7th semester. So these are the link for the modules. So coming to the elective modules, so already the previous experts has thought about this elective modules. There are around 17 elective modules. Out of 17 elective modules, 3 modules has to be completed in 4th semester, 6th and 1 in each semester. That is 4th, 6th and 7th semester. So coming to the semester 4, there are around 3 modules, that is human value, diabetic care and soft skills. So out of these 3, as per the students' choice, the students to take their own, make their own interest, they can do in their respective elective courses. So as per the choice, the students can take and they can complete one module. And for this, in the presidential address, Registrar Ma'am has clearly given the thing that for the elective module, this will be proposed by our registrar.
Prema ma'am, if I can interrupt you, there are lots of voices that we can hear.
Yes, madam.
This is Mohana. Please unmute your mic, please. Thank you. Ma'am, please continue, ma'am. Prema ma'am, you can proceed,
Yes.
ma'am. Thank you.
Thank you for everyone. Semester 4, so elective module out of 3, any one need to be completed. And for all these elective modules, really thank our registrar as a proposed. These module will be available in our website, and as per the choice, the student can complete any one of the module in the respective semesters, and they can get the certificates. Next, please. Ma'am, next, ma'am. Yeah. So I said there are 3 modules in 4th semester, out of which one the student can select. If you see here, these are the 2. Normally, if you see the syllabus, there is no resources available for few of the elective modules. So these are the things what we prepared this one, and this is not entirely for the total units. So maybe in 1 or 2 units, maybe in the link, so we can use as a reference. Next, please, ma'am. And same way for the diabetic care, this is given by our Indian Nursing Council. This is a facilitator manual for training nursing staff on prevention management of non-communicable disease. developed by People to People Health Foundation. And this as booklet is available in INC website. Next, please, ma'am. Coming to soft skill again for this, so few resources we have mentioned here, but so no need to worry about this elective module. So this is going to be put it in the website, and it is easy for us, each and every one of our students, to use it. Next, please, now. And coming to the semester 6. So as I said, there are 3 modules in 4 semester. Out of 3, 1 has to be complete. And coming to the 6th semester, so out of 9 modules, out 4 to 12, it is that total 9 modules, and the student has to complete any one of the following before the end of 6th semester. So CBT, personality development, addiction, psychiatry, adolescent health, sports health, accreditation and practice standard, developmental psychology, menopausal health, and health economics. So here it is not choice of the teachers, it is choice of the student. They can choose any one of them. Next, please, now. So this is about the CBT learning resource. These are the resources, references, and the link I have given. Next, please, ma'am. Next, for the personality development. Next, please, ma'am. So the learning resources are available, addiction, psychiatry. For the adolescent health, really sorry, Dr. Nalini ma'am, actually the technological error, if I'm sharing the thing, I can open this document and everyone can see this. So this is for the adolescent health. Next, please, ma'am.
If you want me to open, I can open one for you, ma'am. No.
Any one, madam. It will be better. They can.
Is that visible?
So you can go directly to the link. So one thing I want to add upon here, so for example, adolescent health, it may be around 4 to 5 units. It is not everything with the one link.
Is that okay, ma'am? Can I close?
Yeah, ma'am. So this is for the sports health learning resource. So if you see all the modules which carries 20 hours, which is equal to 1 credit. Next, please, ma'am. For developmental psychology, then accreditation and practice standard as per the international guidelines and national guidelines manuals are there. Yes, ma'am. Next one. Menopausal health. So learning resources. And for the health economics, only theory 20 hours. So here we have mentioned other learning resources. So coming to the semester, sorry, just it's a typological error. The semesters. So in INC, it has been given, it can be completed in 8 semester, but it has to be completed within 7 semester. There are around 5 modules, that is scientific writing skill, lactation management, sexuality and health, stress management, job readiness and employability in healthcare setting. And for all these 5 modules, I have given the learning resources. So this is for scientific writing skill. And next, for the lactation management, as per the national guidelines on lactation management center in public health facility by the Ministry of Health and Family Welfare. Then for the sexuality and health, these are the references. stress management. And here there are few references and the direct links are available. So no need to worry, as I'm saying that the modules for each module I'm showing all the reference, but it is going to be in our council website. So the modules are going to be prepared by our expert and it is going to be in our website. Next, please, ma'am. And job readiness, employability in healthcare. So these are the references. So concluding this thing, so all the mandatory modules has been completed along with the course, and since it is integrated along with the course, and this is so along with the course there is no separate credit for it. This is all, once again, it's a typological error. And for the elective module, so at 4th semester, out of 3 modules, any one need to be completed in 4th semester. And out of 9 modules, any one need to be completed in 6th semester. And out of 5 modules, any one need to be completed in 7th semester. So number of electives need to be completed is 3. So every module, which is equal to 20 hours. So any questions at the end of the session, you can raise. Thank you.
Thank you, ma'am, for highlighting on the mandatory modules and the elective modules. Hope this.
Really sorry for the inconvenience, Dr. Nalini, ma'am.
It's okay, no problem. We understand all of us do have technical issues. I hope the participants also will agree with the statement. So thank you all. It has been a hard day from the morning. I know it's very difficult to sit in front of a virtual platform for hours together, but you all made it for the sake of learning. Now it's almost, my watch shows it's about 12:40. That's the time in my watch. Okay. So can we be back by 1:40? We will give a break for 1 hour and let us be back by 1:40. So can we log on by 1:35 so that all of us are ready to go in for the next session?
Okay.
Again, gentle reminder, keep all your RN, RM numbers ready. You need to put that in your feedback form. So don't be searching unless and until you give your RN, RM numbers. Your feedback is mandatory, and based on that only your credit hours will be given to you. So
Yes, ma'am.
Consideration, please bring your RN, RM numbers without fail. So in the evening, you will have a discussion session. In case you have any queries or any questions or any suggestions, please post it in the chat box. We are trying to collate all your questions so that it can be posted further and discussed in the discussion session as such. Okay, so now we'll break for lunch. Sorry, we are not able to provide you the lunch boxes here. Please go, have your lunch and be back exactly at 1:40. Thank you.
Okay, thank you.
Good afternoon.
Hello, good afternoon, Dr. Nalini.
Yeah, good afternoon. Can we start the afternoon?
Yeah, I'm ready.
Yeah, I just want all of you to have your videos on so that we can take a nice picture post lunch. Just all of you keep your videos on. Yeah, that's great. So Dr. Kandaswamy is here to take nice pics for all of us. Dr. Kandaswamy, are you in?
Yes, ma'am.
Yeah, thank you so much.
I'm ready.
So we're all there with nice photographs. We'll start with a pre-photographic session for the day 2, for the post-lunch session.
So there are around 198 participants now, ma'am. So we'll wait for some more to come.
So as they join, you can start off with the first page, second page.
Okay, ma'am.
Sangeeta, put on your mic, please. Sangeeta from Bharat College of Nursing. Can you switch on your video? So once you have done, you can just inform us, sir.
ஃப்ரைடே போட்டுடலாம் நம்ம கிளாஸ்.
Kindly mute your mics. Videos on, mics off.
This is Seema from Paul's College of Nursing, Anuradha Gopal from Anne Velagani, Newton Paul Singh, Scudder. Please put on your video. Let us take a photo. Prashanti.
Okay, then thank you all. Now we move on to the post-lunch session. I have the first speaker post-lunch. We have Dr. Sharda Ramesh, who's going to talk about an important concept, something which is new for nursing, the new grading system. And she's going to tell us about the SGPA, the semester grading pattern system, and the cumulative grade point assessment, how it is being done. And as teachers, we should know how it is important, because the entire system is tomorrow, it's going to change. And all the students are going to discuss only about credits, grade points. And they're going to talk about class, all those things, grades, credits. And we all should become familiar with these terminologies. And I think we have a right person on board to talk to us about the new grading system. Over to you, Dr. Sharda, Principal, Vinayagar Mission College.
Good afternoon, Dr. Nalini, for those kind words. Am I audible?
Yes, ma'am. I think you're.
Hello?
Yeah, you're audible, ma'am. You're audible.
Is it very unstable? Can I switch off my am I audible to the audience? Yeah. Is my PPT visible?
Yes, ma'am.
Yeah. Good afternoon, Dr. Nalini, dear Dr. Kandaswamy. At the outset, let me first thank Dr. Annie Grace Kalaimadi, the Registrar of Tamil Nadu Nursing Council, for giving us this wonderful opportunity of co-coordinating this event, as well as presenting this particular session on grading system that is there intact in the new syllabus. I also, in advance, thank the silent virtual listeners out here. Thank you, Dr. Nalini, for those kind words. Now, coming to the objectives of this session, at the end of the session, the participant will be able to define terminologies related to grading system, compute SGPA and CGPA, interpret the UGC 10-point grading system, and choose appropriate grade qualifying for a pass. Now, keeping these objectives in mind, what is the new things that has come into place because of this revised nursing syllabus? Now, let us understand that across the nation, all the other disciplines, including allied health sciences, have moved on with the credit system, whereas nursing only was looking at the mark system. Now, this mark system is outdated in the international forum. It is considered to be not so efficient system. It is a conventional system. See, like how we have moved from, can the delegates please mute your mics? Can you please mute your mics? Yeah. So the UGC in its 10-point grading scale initially said all the courses, including the nursing and all the allied health sciences, should move into a grading system with the credit points only. Why? For equity, efficiency, and excellence in higher education. How did they define all these terms? I can take another 2 hours of session, but let's just look at the bird's eye view of what the UGC has given. Can the delegates please put off your mute yourself, please? I can get a lot of echo. Please help us. Enhance a quality in examination and evaluation system. Yes, please. Yes, Nalini.
Punita ma'am to mute all the delegates.
Yeah, could be better, because I can hear a lot of echo also, as if I'm talking something mari irukku. I'll keep talking, Nalini.
Yeah, I'll just request you, ma'am. Please continue.
Yeah. So
Sharda ma'am, for a minute, your mic is muted. Sharda ma'am.
Yeah. I didn't do though. Anyway, sorry. Yeah. Okay. Enhanced quality in examination and evaluation system. Vetri Chelvi, can you please mute your mic? Yeah. Infer the performance of the students across the international forum. Our students also will go with the same kind of a transcript, same kind of a mark sheet. Everything will be the same grading also, whether they are first class, distinction. We are matched with the international platform with this UGC 10-point scale. And why am I not moving? Babri, why did I not move? Yeah, is it moving now? Yeah, student mobility across institution is easy with this point of scale and the credit system. Credit system already morning they've explained to you. Now, how will you convert those credits into grading point and whether you will give first class, distinction, rank order? How are you going to do that? Potential employers assess the performance of the student with this grading system only across the nations. So that is why they thought a uniform grading system will be better. And nursing is not away because we are the most suppliers for the international forum. So we have to go with it. Followed in the top institution abroad and here. So we have moved on with this. So that is the reason Indian Nursing Council has also come out with this. I'm sure many of the deemed universities, when you all had, if you ask those principals, they will tell you, whenever we sit in a board of studies or an academic council or with the controller of examination, they keep bombarding, asking us, why is it you people are having mark system when all the other systems are having a grade point? So now coming to the revised regulations, the absolute grading system has been obtained from the UGC. UGC, all of you know, Union Grants Commission. They are the people who give us all the guidelines for the higher education across the country, pan-India. So they have given a 10-point scale. Now, out of this 10-point scale, how did we modify for the nursing? Because it is a skill competence-oriented, competence-based learning we are doing. So again, the uniform scale is what we are. Now let's look into some of the terminologies, what here we would like to. Absolute grading. Now what is an absolute grading? Each point value is assigned a letter grade. It doesn't miss, like 74.9 we usually as teachers we do is 75, we round it off and put a letter grade, but here it will not happen. As you go with the calculation also, you will know how it is derived. So 74.9 and 75, there is a difference of 0.1 or sometimes our heart aches when we do the internal mark assessment also. I'm sure many of you teachers would agree to me. A student who never came to the college would also get almost the same marks. So that variations could be matched here. So that is what we call it as an absolute grading with a letter grade also we are giving. Now course, since even Dr. Fabiola, everyone was talking about the course, and even Dr. Annie was reiterating that a course is a subject. Earlier, what we were calling as a subject, now we are calling it as a course by a department for learning in a particular semester. So how many courses are there in one semester? 4 or 5 or 6, depending on that. So altogether, we have 30 courses in our 8 semesters. We are 7 semesters, so to make it precise. We also have a credit-based semester system. Again, Dr. Fabiola and all the other initial speakers were reiterating it. What is a credit-based semester system? How a tutorial is calculated? How tutorial in the sense like now lecture. This hour, how it is calculated? How in a simulation, in a lab, in an OSCE when you give, how it is calculated? And how when you take the student to a lab, I mean the hospital, what is the difference? So these are all 3 things, different aspects we give in nursing. So the credit-based semester system is a requirement for awarding a degree or a diploma. So since morning they were telling how many credits we are giving, how many scores are given for each of the semester courses, all these things Dr. Fabiola was nicely making it. If you recollect, you will understand. Until you complete all those credits, the degree certificate will not be given to the student. And that degree certificate now is called as a program. Program is a 4-year BSc nursing program. That 4-year program comprises of so many credits, which is there in each semester. So that is why and each semester is built in with The minute thing is the courses that we offer, whether it be applied psychology, applied sociology. So let us come from the downline. Applied psychology, sociology is a course for that. For each of that course, you have certain credits already prescribed by the Indian Nursing Council. That is a statutory. You have no authority to change that. Let me reiterate it. Credits are credits already given by the statutory. We don't have any authority to change. And it is very easy for nursing because we are looking at 100% attendance. So you have to complete all these courses and all these credits to get what? To get the program certificate. That is your BSc nursing pass paper, the degree certificate. So that is what we are doing. Now, how is this credit defined? There are various ways of credit, but let us understand an easy definition, the minimum, bare minimum. Like, I'm not looking at a dessert, a soup, or anything. I just need a rice and a curd or a sambar, that sort of a thing. So now credit is defined in any book. It is defined. It is a coursework which is measured, and 1 credit of tutorial is equivalent to 1 hour of credit. I mean, one hour of tutorial is 1 credit. And if you are looking at the 2 hours of lab work, you have 1 hour of credit, and 4 hours of clinical work per week is given as 1 credit. So this definition, keeping this at bare minimum, you, even if what Dr. Fabiola was talking in the morning, like how it is defined, it will increase. For us, it is given as 80 hours, 1 credit for the internship they have given. That is because high competence you need. By the end of the term, the student should be able to do everything, manage the ward, conduct a delivery, manage the crisis. She should be in codes blue. She should be looking at the casualty, whatever, how she is handling the crash cart, everything she should know. So that is why that hours are more, but the credits are 1. So if you look at other disciplines, is it the same for across all the disciplines? Now, it differs. In medical is almost like us only. We have almost taken the NMC, whatever the credits. But if you look at astronaut or an aeronautical engineer, their credits are more. More lab they were, credits are the same, 1 or 2. Why? Means it is competency based. Let us keep it in our mind. It is competence based. So with whatever hours, more skill and more habit, and you get 1 credit point. So the credit point is a product of grade point and number of credits for a course. Now, how will you add all those credits? That is already for us very easy. It's given in your syllabus. Just add everything, you will get that semester credits. What is a cumulative? And adding all those 8 semester credit, you get a cumulative score for the program. Now, letter grade. What is this letter grade? I'm sure those of you who have school students in the CBSE or even in the O-level syllabus or an American syllabus, I'm sure you're very familiar with this O, A plus, A, B plus, B, and C and F. Now, how it is defined? You go from the downline. It starts from F, which is a fail. This is a grade point scale given by the letter grades given by the UGC. F, if you take arts and science, if they get 40, less than 40, they become fail. But what is the difference in nursing? We always say 50 is our pass mark, isn't it? So 50 means you come under the letter grade of C. So start from here, 50 is C, then B. We will look into the table. As we go, you will understand that. So go from down. F means fail. All of us know that F is fail. So after fail, now less than 50 mark in nursing is a fail. All of us know that. We've been practicing it, so I don't need to insist on that. Now, what is a pass mark? 50 marks. Now, what is a letter given for that? That is a C grade. So you start off from 50 marks with a C grade and then move on to the B, move on to the B plus, move on to A plus, and then O means outstanding. You should put 1 O podu, you should do there. So you start, what is our grade letter grades for nursing? We start from C, there is no F. F means it's fail. Less than 50, it is a fail. So we start from C, I'm reiterating, we start from C, move to B, move to B plus, move to A plus, and then 6th letter point is O, which is outstanding, 90 and above. So when you know this, O is outstanding, C is O is about 90 to 100. C is 50 to 60. Let's go in between. What are those? As we do the calculation, you will understand. First, understand the two ends of the continuum. In between, we will learn it as we move. I'll show you the workout. You will understand that. Grade point, it's a numerical weight allotted to each letter. 5 marks, 6 marks. Okay, in a continuum. Now, a visual analog scale, pain scale, Madri. In the smiley potaka, you have this many scores, this one. So that is the interpretation you are giving. That also we will work. Program already I told you, the whole cumulative of all the 8 semesters where the student gets a degree or a certificate, it is called as a program in itself. Now, academic year, one definition we should understand is academic year, 2 consecutive semesters, one odd, one even. One semester and the second semester. If you put together, you get a 2 consecutive semesters. So in a year, you have one odd and one even semester. Odd is 1, 3, and even is 2, 4. Like that, you add up till 7 is odd number, 8 is a even number. So 7 and 8. So like that, you will always have an academic year calendar as odd and even, and that makes 12 months of a course, or at least 11 months with 1 month vacation. So that gives you an academic year for that particular candidate. The next thing is transcript, grade card or certificate. It's based on the grades earned. A grade certificate will be issued to all the registered students every semester. Now, this certificate will reflect the course code. Dr. Hepzibah had clearly put in her framework as to how this works. You will have a course code. The course code is already determined by the INC. There will be your university code. Yenaka university needs some kind of an easy access. See, the university conducts so many programs, isn't it? They are having pharmacy, they are having allied science, they are having medical, dental, whatnot. So they will give a course code. Add on to that, Dr. Fabiola also reiterated, do not change the course code given by the Indian Nursing Council. So university code will determine in their academic and board of studies what code they want for that nursing subject, 00 something or whatever. And then the course code determined by the Indian Nursing Council will be reflected on your transcript, because that is uniform now for every pan-India, whichever student, wherever, whether it be in Manipur or Meghalaya or in Tamil Nadu or in Tirunelveli, she's going to study that. And that course code will go with that. Title of the thing, applied psychology, applied, psychology and sociology, applied anatomy and physiology, or communicative English, all that will come. Then a number of credits, already I told you, we are working on 100% attendance. So whatever the credit given by the Indian Nursing Council, till she completes, she or he, we will not give that. Up till 80% is feasible for exam. Beyond that, it is full. We have to ensure that she completes it. And grade secured. What grade she has secured? Whether she is a letter grade, whether she is A plus, B plus, and what is the grade point given to that 6 or 7 or 5 or whatever. We start from 5 and move on till 10. So in that 5 grade point scale, we will be moving as we do that. Along that, we have SGPA. Now, what is SGPA? Semester grade point average. There is an average taken for each semester. We will do the calculation, not to worry. Just understand the word, letter, abbreviation. As we move, you will quickly learn. We've seen that earlier sessions, we were able to give these answers. CGPA is cumulative grade point average. That is the expansion of these two words. So all put together, the transcript will reflect the students. It's like a jatakam. It is your whatever the kundli, whenever your everything, when you were born, which parents, which place, which time, like that. If you take a CGPA of a candidate of a BSc nursing, you will get everything about her, from where she came, what was her attitude, what is her affective domain, what is her psychomotor, how many grades she got, has she got anything more than that, did she go abroad for some student exchange program to Japan or to US or whichever country. So the whole thing will be there. No employer need to ask, did you go like this? So that is the easiness of this. So there are two transcripts here. One is the academic transcript, which will reflect all your marks and the credits that is from the syllabus that is taken, that is issued by the controller of the examination. They are the competent authority. There is another one thing what Dr. Hepsi was talking about today morning, that is your micro transcript or the clinical transcript. We call it as clinical transcript because the academic will show medical, surgical, like that. But in medical, where did she go? Did she go to ENT? Did she go to gynec? Did she go to any other, oncology or burns ward? Did she have a better practice there? All these details will come in your clinical transcript. So the clinical transcript, the competent authority is the principal who issues in the college. The academic transcript is given. We don't have the authority that the university will issue, and the competent authority is the controller of examination. And already I told you, semester grade point average, which is a total of all the courses, all the credits obtained in that odd and even, odd and even courses, odd first semester and second semester, all put together, 1 SGPA you get. Like that, first semester, second semester, third semester, 4, 5, and 6, and 7, and 8, all put together, you get a CGPA. I hope I'm making it very clear. When you say SGPA, it includes first and second semester put together, all courses, whatever she learns during that 2 semester put together, including her marks, the credits that she obtained, and which will be near expressed in 2 decimal points. Right now, what we are doing in the mark system, all the decimal, we will put it as round it off. We have this practice when we do the IA, we round it off. Everything we will round it off. And 74.9 also will become 75, 73.69 also, again and again you add and add, and finally you bring out to the district. So this is we have been doing, that will be avoided or prevented with this sort of a calculation. CGPA, as I told, all the sum of all the credits obtained during all the semester that the student, we have 8 semesters. So all total together divided by your credits, you get the CGPA, and that is international, and also 2 near decimal points we are giving. Now, coming to the 10-point grades. I already told we start off with F. F in UGC is less than 40 because they are looking at a higher education, even for arts and science, everyone, management, so many courses. But we are competence-based, medical and nursing and all come under the high level higher education competence skill learning we are doing. So what we are doing is less than 50% is a fail, like before only. If what we are doing right now, the exams also 50% less than you fail. That is absolutely understood. So what is the next level? 5 with a grade point of 5. That means 50 to 59.99. Understand the range there. Up till 59.99, 2 decimals you are keeping there. Don't convert it. Usually internal, what we do, this 9.99, we take it. I'll put the cursor here. See this 0.99, what we do in our internal marks, this you convert and take it as 60. And again, you have 1 more 9 there, you take it as 61. Unnecessarily, we give a credit to the student who is not eligible for a first class. So this is where this grade point will help you henceforth to match the competence of the student. No heartache for a good student. No, high achievers, they will get a better platform of visibility. And C is, again, you start, F is fail, less than 50. C is 5 and it moves to 50 to 59. You have around 9.99 of a range there. The next one is B, which is mentioned as above average, which comes as C, the 6. And that is 60 to 64.99. Almost 4 points. You can see the range here. The range varies here. You have 10, almost 9.99 range. 10 60 to 64.99 is 4 range you are having. The next is B plus, which is good, and which is 7. You go like this. C is 5 and B is 6. And B plus is 7. So B is again divided into B and B plus. B is above average, which is 6, and which comes under 60 to 64.99. Right now, we are talking about first class. We are looking at. And something called as 7, B plus is good. 7, which is 65 to 74.99. So you understand here, from C's, there is a range of 9.9. 10, if you put in a graph sheet, you will have 10 boxes here. So, but B is only 4 points. Remember that it has got only a range of 4 points. Whereas B plus, it comes as 65 to 74. That means again there what is happening? There is 9 graph points you can look at. And that makes us 7. And that is your grade point. And the next thing is A, very good. So 5, 6, 7, 8. So you go like that. It's a numerical, but it's easy to understand. And what is the percentage mark for the student that she obtained? It is 75 to 79. Again, it is a 4 range duration. 5 to 9 and there will be only 4 range duration. The next thing is A plus, which is excellent. And the grade point, you move from 8 to 9. And that is 80 to 84.99, which is again a 4 range that is given. Then the next one is 10. UGC grade point scale 10, which is more than 85%. Anything above 85 and 100 or 90, that moves as outstanding, and the student gets a grade point of 10. So your bell curve satisfy here. So the grade point of 10, and you get a 85% and more marks the student obtains, and the letter grade given to her is O or outstanding. So you move on from A, absent is absent only, AB. All of us put that, you get a 0. And remember, once it is absent only. And once it's fail, it is fail only. These students will not be considered for the rank order. This grade point in the cumulative plays a very important role. Semester, she will escape with the attempt and she will somehow get the score. But for a cumulative, grade point will be calculated, but you will mention a point that she is not eligible for the rank. She would have lost it. So remember, we move from C to B, B to B plus A, and A plus, and then O. So that we start from 5, 6, 7, 8, 9, 10. That is the grade point. Mark, little differences are there. Some places it is 4 ranges there. Some places it's 10 range. If you look at 10 range, C is a 10 range. Again, B plus is a 10 range. And the rest of the things are all, it is 4.99 range. So remember that there was a corrigendum again given by the this thing for the past percentage, and that we have already looked into the notification and we have made it. However, pass is 40 for all the core subjects except communicative English, which is 40 to 49.99. If she gets 41 mark, she is a pass in communicative English. The same way, electives do not have a grade point. 5, 6, 7, and the Mary grades, like just you can give the percentage and passer. Whereas all your courses, core courses, whether it be psychology or it be anatomy or it be foundation or pediatrics, we give 50 as the pass percentage. So the only 2 places where the 40 is concerned, a grade point of 4 is given for English, which is a pass if she gets. But nevertheless, we don't add them in the SGPA. We will not add those marks in the SGPA calculation. So here, communicative English, electives, the should not be included for calculation of SGPA. That is one important. Why? Because it is less than 50%. All our core subjects are more than 50% if you want to pass. Now, this is a formula for SGPA. What is SGPA? It is a semester grade point average. Now, where is this semester? You have first and second semester, 1 SGPA, third and fourth semester, 1 SGPA, fifth and sixth, 1, sixth, seventh and eighth, 1. So you have 4 SGPAs totally you will be getting. So here you can see what is C. C is the credit scores of that particular semester, all the credits added. and the grade, whatever the student has grade point scored. She would have scored 5 in pediatrics, she would have scored 6 in mental health, or 6.84 or something like that she must have scored. So this plus this and plus whatever courses she is studying in that particular semester, all 4 courses, divided by the credits of those courses. What is the credit given to pediatric? What is given to community? What is given to for that particular semester? It's very easy. You take your syllabus, it is very easy for you. Only remember the formula. The credit obtained by the the credit given for that course, we don't have a change, unlike arts and science. That's what I'm saying. We don't have a change there, because the credits 100%, if you get only, you move her to the course itself or move to the next semester. So the credit is easy for you, already given. Only now we are looking at the grade points scored by the student. That and into this, it's all the courses for that semester divided by all the credits given by the syllabus for that particular semester. Let's make a very simple calculation, you will understand. Now, for example, semester 1. Semester 1, you have English, communicative English, anatomy and applied physiology, applied sociology, and applied psychology. So you have 3, courses that is there in this particular. You have a course title given by this INC syllabus itself. This is the course code 101, 105, 1110, all these things. That's for the easy understanding for a calculation. Now let's look at how these marks was obtained by the particular student, say X or Y. She gets 80, 75, and 70. Now let's look at the credit what is given. 2 is for English, 3 plus 3, that is for anatomy 3 and physiology 3. So that makes 1 credit. Just for our easy understanding, C1 we have put for this subject, and applied sociology and applied psychology, C2 we have put. We are not adding the elective for the calculation. You should, communicative English for the calculation of SGPA. Now the mark obtained. So if she is getting 75, the letter grade given here is A. If she is getting 70, the letter grade is good, that is B plus. So what is the grade point given? She gets a 7 and 8. Already we have done that. Now coming to the calculation, credit point, C into G. Now what is a C? C is the credit. How many credits you have for these 2, anatomy and physiology? You have a 6 credit. Are you all following the cursor? I hope you follow. And for that 6, this anatomy and physiology, what is the grade point we have given? She has got 8. How did you derive this 8? She has got 75 marks. So the letter grade is 8. Whereas in the grade point of a 10 scale, she has got 8. So 6 into 8 makes 48. Like that, the next subject. For this semester, you have got 2, 6. And then she's got 3 plus 3. You have got 70 marks, and then the letter grade is B plus, and the grade point is 7, G2, and 6 into 7 is 42. So keeping this in mind, that is how the SGPA is calculated for all the courses that you are doing in all the semester. Follow the red points given here when you do the calculation, whereas we did not calculate C into G for this communicative English. Why? Though the student has got 80, the pass percentage is only 40, and it is determined not to add it in the SGPA. So we have not added this calculation. So now coming to this. Now, how did you derive this SGPA? Already the formula we have discussed. So we have taken the anatomy, physiology, and psychology and sociology divided by those 2 credits. Luckily here, both the credits are same, 6 plus 6. So that makes 12. Already what have you obtained? The student has obtained, you see, 48 and 42. So we have made it as 48 plus 42 divided by how many credits? It is 12 for that semester of 1. And she gets 90 divided by 12. You can simply put in your calculator also. If there is any mistake, you can tell us also. You get a 7.50. This is what, luckily it is coming as 7.50. Suppose usually here, if it is more than 5, we have a tendency of adding this 5 into 6, and this 6 will become 8 here. So that is where we are not doing. We leave it like this. 7.50. We are not converting it, even if it is 5 or double, 2 decimal should be kept there. The next, these 2 decimal will be kept in place. For example, hypothetically, if I say that now the calculation is 7.55, well, the tendency is 5, this 5, where the 0 is there, that 5 is converted into 6. And then this 6 will convert it, this 7 into 8. That will not be done in SGPA calculation. Please understand that 2 decimal, first 2 decimal will be kept in place. Okay. So the next thing is you have another, this is again, we have calculated the SGPA where elective marks are not added for calculating SGPA. Already I told you electives are not calculated, whereas the rest of the C into G, how many subjects are there? You have child health nursing 1 and 2, mental health nursing 1 and 2, nursing management 1 and 2. All these put to the credits are already given. This credit is very easy. It is given in your syllabus. You have a theory, you have a practical. You have a theory, you have a practical. You have only theory paper for management, nursing management. So all these credits put together, you are going to calculate this. So you have 5 credits for theory and the grade point obtained by the student is 7. So that you get 35. Here in practical, you have a 6 credit. 4 credits and the student has scored 6 grade point. So that makes 24. Here you have 5 credits and the grade point she obtained is 7. You have 35. Again, in this, you have a credit of 3 and you have the student as this is obtained by student. This is in your syllabus already given. Remember that credits are determined. Marks, letter grade, grade point is determined by the student, what she obtained. And this credit point is calculated by the competent authorities. As simple as that. There are how many columns here? You have 5 columns. Out of this credit is already determined. It is there. Marks, once the student gets, you get the percentage. That you convert whatever we said, A, B plus letter grade you give. And for that you get a grade point. So that will be determined. So credit into grade point, you get the C into G for this particular. However, electives, see here, last point, health economics is the electives for this 6th semester. You are not adding that for this SGPA. So the computation of SGPA, how did it go? Already we have seen there. So 5, this is theory, practical of child health, theory, practical of psychiatry, and this is nursing management. So that credit is already determined. That is your denominator. The one, the numerator is all what the student obtained. And now coming to round off to 2 decimal points. This is what I was telling. Always 2 decimal point will be there. So you are having 428, 0.46. You calculate in your calculator, you will get this answer. Not a big, it's not a big rocket science. All of you know that. You are pretty much expert on that. So 6.428. This is where the funda comes. This 8, if we will turn, and then make it into somehow this number also will change here. Now we are not doing it. So 6.2, we make it as 6.443. Now coming to CGPA calculation, cumulative grade point average for all the semesters, which is indicated as a final, grade or a mark, and which is very useful for the rank order in the university or in the college level, wherever. And CGPA reflects the fail status in case of fail till the courses are passed. You will not get that. You will hold that. You cannot give the grade, the CGPA till she or he clears all the exams. And if she fails in any part of the time, that particular student will not be added for the rank order of the particular university, or the class ranks will not be given. Now, how will you declare the CGPA? Now, coming to the CGPA, we go to the calculation, you will understand the SGPA divided by the credit is the CGPA. So easy it is. Now, how will you declare a pass? Suppose we said 5 is our grade point for 50 parts. 5.99, I told you the range also there. That is a second class for us. We do that. Now also we do that. Now coming to 6 and 7.49 is a first class. So you have this range and then first class, and 7.5, that is 75% and above, she goes with first class and with the distinction. We write it. Earlier what we write, first class and then distinction. Now we write 75 and above is first class with distinction is the nomenclature with the current declaration of the pass. And above that, O level, all the SGPA is O, then obviously the student will go into a university rank. Now, coming to the CGPA calculation, I said it's a cumulative grade point average across all the semester divided by the credits. So SGPA, already you have calculated all the SGPAs. Now, summation of that divided by the number of credits for all the semester gives you the CGPA of the particular student. That is the Jataka of the student. She will carry that, and that will determine her rank. That will determine her performance or her portrayal in front of the employer, everything. Now look at here. We have semester 1, 2, 3, and up till 8 we have made. Now these are hypothetical models. These credits are already given in your syllabus. There is 12 credit. You can go through your syllabus also. 31 in second semester, 17 in third, 4 is 21, 11, 21, 26, 12. Up till all the 8 semesters, this is determined by the Indian Nursing Council. You have, or I have, no authority to change that as it is. Now, this is a SGPA, like how we calculated earlier. We have given a dummy figures of SGPA with all these. Just a hypothetical calculation we have put. Now, how will you calculate the CGPA of this? Now, look at it. Credit into SGPA gives you the scores of that particular, for the computation of CGPA you get. Already the credit is 12. SGPA already we calculated earlier. Now, that into this gives you these scores. Now, this is again a hypothetical. If you really work out for a student who is obtained this mark, you will get all these things. Now, adding all these together, here you see. So credit into SGPA, credit into SGPA, credit into SGPA. SGPA is a separate calculation we have made earlier. And then we are moving to CGPA. CGPA also has got one more calculation, credit into SGPA. So credit into SGPA divided by all the credits of the particular course, she will or he will get a CGPA, which is with the 2 nearest decimal, that is 7.50 at the hypothetical mark sheet we have made. Now, if the student gets anything, already we said in the previous slide, So you remember here what you have seen, 7.50 and above, you are talking it as you are naming it as a first class with distinction. So that is what we are giving here for this particular candidate. Once you take up this, you go home and work. We also have an activity sheet. Let me go to that. I'll give you quickly. You can do this activity sheet. Can you see this here? Can Dr. Nalini, could you please tell me whether, see, this is an exercise we are giving you. 4th semester mark sheet. Did I share it, Dr. Nalini? Can you see that? No one is telling. Can you see this? Nalini?
Yes, ma'am. Yes, ma'am.
Yeah. Okay. So this is a simple exercise we have given you how to calculate a compute SGPA in the 4th semester. For example, now the student has obtained, you can see here, in the pharmacology and pathology and genetics, that is whatever the PPG 1 and 2, that is based on your syllabus. Why is it not running here? Can you see this here? Yeah, standing. Yeah, can you see these marks here? See, the student has got, the credits are already determined by the Indian Nursing Council. There is one elective here that is with 1 credit point with a diabetes care that you will not take for SGPA calculation. Now the marks obtained by the student is 14, 17, 33 and 17. That the pass mark is already given to you. That is a standard that is given there. Marks obtained here by the student in the university. He has got 39, 46, 38, 19. So that gives you the marks obtained here. And the pass mark is the standard. This is a standard. Let's not, this column, you just forget it. Pass mark, all of you know, for 25 it's 12.5, 37.5 is for 75. Now the final marks obtained by this particular student in this pharma, pathology, genetics is 53. Adult health nursing 2, integrated with the whatever the electives that has been given, that is a mandatory module, he gets 71. And the professionalism, ethics and all, he gets 72. Elective is 63. Nevertheless, we are not calculating it for our SGPA. So the letter grade here is, we know it's 50 is C grade. We know that, we already studied that. And in theory, the student is getting 63, which is B grade. And in the practical, he or she gets 71, which is B plus. And in professionalism, there is no practical, only a theory paper. So 72, it becomes B plus. Now, what is the grade point? Already it is a standard calendar. We have showed you 5, 6, 7, 7. So now, please calculate your, we want you to, I'll just give you 2 minutes time. My time on my laptop is 14.28. At 30, I will stop this. You can work out. Someone can tell the answers, please.
They can raise the hand. I think everyone.
Yes,
has
they
been,
can, or put in the chat box. Yeah, you don't need to. Some methodology you adopt.
Vaishnavi, can you just put it in your chat box, please? Somebody has given an answer, madam, 5.76. Deepa.
Deepa. Yes, you're wrong. Look at this. No, 1 minute. I think you're right, I guess. 1 minute.
Revati has put as 6.09. I think that's the
6 point. This one. 6.09 is a correct answer. Revati, you are absolutely right. 5 is a wrong answer. So this is how we are working out. Can you, is that visible, Dr. Nalini?
Yes,
is this visible? Answer key is visible?
No. It is not visible.
It's not visible. Why?
Answer key is not visible. I can only see the chat.
1 minute.
You need to.
1 minute. I'll just this one.
Answer key is in another file, ma'am.
1
there
minute.
Is a different file for answer.
Yeah. 1 minute. I'll just I'm just searching for that answer key. Yeah, I'll share it now. Yeah, is that visible now? Answer key?
Yeah, you can just
see,
increase the size.
Yeah, I'll scroll it. Yeah,
scroll it
down. Yeah. We have the 2-3 exercises. We didn't cut it. See, this is for your pharma. Okay. Dear delegates, look at it. Your credit point is, you have 6, you have 7, and 1 credit for the professionalism. The obtained credit point, what the student has got is 30, 42, 49, and 7. Already we have done that calculation. Credit into grade point. Credit is 6, grade point is 5. So that gives you 30, 42, 49, 7. For diabetes, we are not calculating because we already said it is electives. We will not calculate. So we did not calculate. Now coming to the calculation of SGPA, how did you derive it? 30 plus 42 plus 49 plus 7. This one. I hope my cursor is going there. Divided by credits. 6, 7, 7, and 1. So that gives you 21. So your answer is 6.095. Revati, congratulations. So here you are taking it as, I'm sorry, I ran it. You are taking as what now? Though it is 6.095, you will only add this 5 as 1 if you raise. You need to give 2 decimals, right? 2 decimal points you have to give. So if this 5 is converted to 9, then you get 10. So your answer is 6.10. Revati was very near to the answer. Congratulations. So this is the kind of an exercise that we will be looking, and you can do it. It's not a big deal, basically, because all of us are trained to do this. And any doubts or anything, I think we are taking it to the discussion at a later point, I guess. Am I right, Dr. Nalini?
Yes, ma'am. If there is any questions or anything, they can post it in the chat box,
We can.
which we can
Yes,
take it up
yes.
later.
Yes. So thank you so much for your patient listening. Thank you, Dr. Nalini and Dr. Kandasamy, for facilitating. Once again, I submit my humble thanks to the Registrar of the Council. Thank you.
Thank you, Dr. Sharda Ramesh, for that wonderful presentation of SGPA and CGPA, the new terminologies that we are currently supposed to follow in nursing. I hope it gave clarity to the participants they were also able to calculate with the exercises you have given them. Thank you so much.
Actually, yeah.
Yeah.
Thank you. Thank you so much.
If you have any further clarifications or doubts related to the calculation of SGPA, CGPA, please do put it in the chat box so that the experts will be available to answer your queries during the discussion time. So again, a humble request, please keep your RN/RM number ready so that you can fill up during the feedback session. And now we will move on to the next session, which is going to focus on the formative and the summative evaluation. So I'm going to straight away go off. Yeah, I hope my PowerPoint is visible. Kandaswamy sir, is my PPT visible?
Yes, ma'am. Yes, ma'am.
Yes, thank you so much. So thank you so much.
Please put slideshow, ma'am.
I'm good. I'm going on. Good afternoon, all of you. Once again, having discussed about the SGPA and CGPA, now we will move on into the important aspect of examination. So all these days we were thinking students are the one who get really, carried away with the examination part. But today, as faculty members or teachers, we are equally important in order to give the best of formative, summative assessments for the student. And INC has very clearly given guidelines how to conduct, how you should structure your formative and summative assessment, the weightage that you should give for each one, and how it has to be calculated. Now, when you try to do this formative system in a very, very transparent manner, it becomes easy for us to tackle the present day student needs, because today the students are, a lot of competition is there among students, and they want transparency, they want clarity in the marks you give. I know that all of us do have a system of giving evaluation for our students. Now, once again, Indian Nursing Council has clearly given us guidelines what we should follow during the formative summative assessment. So the objectives for this session is going to be what are the regulations that has been laid down for formative summative examinations, and how to distinguish between continuous assessment and sessional examination. Now, these are two terminologies that is coming up new here. One is continuous assessment, the other one is sessional examination. Now, we should also know the question paper pattern that we are supposed to follow, which is based on the courses of the subject. So there is a variation of pattern that is cropping up for every course that we give, based on the number of courses that has been combined. And also we're going to apprise you about the continuous assessment for theory and practicum, and what evaluation formats you can choose as modules. Now, we all know that these are two important points that I wish to stress here. In your internal assessment, you have distribution of marks that has been given for end semester college exam. you have IA marks that is being given, and you have end semester university exam. So these are terminologies that we should get accustomed to. End semester college exam is the exam which you conduct in your college, but you have to send that marks for which you have conducted the exam to the university so that it appears in the mark sheet. So for this end semester college exam, you teachers will conduct the exam in the college, and it will be certified by your principal, and it will be sent to the university. Whereas end semester university exam, theory and practical, it will be conducted by the university. Now, in your internal assessment, theory and practical, you will have two components here. One is called as continuous assessment. The other one is called as sessional examination. Now, there is a weightage that is being given for continuous assessment and sessional examination. Normally, combination of this continuous assessment and sessional examination is what we call it as formative assessment. Now, this formative assessment is also categorized now into two, continuous and sessional. Now, continuous assessment carries a weightage of 10 marks, whereas your sessional examination carries a weightage of 15 marks. So totally, your IA will be equated to 25 marks. Priyadarshini, if you can just put off your mic, please. Thank you. So here, you will have the combination of these two taken into consideration to calculate the IA for 25 marks. So again, the assessment is going to be through grading system. I request Priyadarshini to just mute your mic. One second. Yeah, you can see here in the internal assessment for theory, you have a calculation for about 10 marks. This is for the continuous assessment. And in the continuous assessment, again, even though you have for 10 marks, you have for attendance, which is, 2 marks is given for attendance. And you have for assignment 10 marks being given. For presentation, it is 12, which can include your seminars, micro teaching, individual presentation, anything it can be which you give for your students assignments. It can also be a group activity which also carries some marks. So all the marks which you have got for one particular course will be out of 30. Now this 30 marks has to be converted to 10 marks to calculate your continuous assessment evaluation. Again, in case there is a mandatory module, if it is there in the particular course, see to that mandatory module has to be evaluated for 10 marks. Again, you can evaluate for 100 marks, no problem. You convert it for 10 marks so that you derive out of 40 marks, which will also include the mandatory module. Now, whatever it is, whether you do it for 30 or 40, irrespective of the total marks that you have got, you have to convert for 10 marks, which is your continuous assessment. So this is the weightage which is given for continuous assessment. Moving on to sessional examination. Now, when it comes to sessional examination, I told you already, it carries a weightage of 15 marks out of 25. Now, the sessional examination, again, there is a prospect that has been given by INC, which says that you are supposed to conduct 2 sessional examination every course. And the sessional examination is curtailed only for 1 hour. So for that 1 hour paper, you have to give MCQs, essays, short notes, and very short answers. Again, you can see that you have for 2 exams to be conducted, and then you can continue for converted for 15 marks. Now, during the discussions we had with our principals and vice principals across all the colleges in Tamil Nadu, a resolution was once again taken up that we will have 2 sessional examination as mandated by Indian Nursing Council. One examination will be for 1 hour, which is having a marks of about 30, whereas the second examination will be very, very similar to the university examination, which will be out of 75 marks. So we all thought that we should give an exposure to our students to gain, what is the pattern they're going to get in the university exam. So that similar pattern can be given in the sessional examination also. Now, previously we used to use the term model exam. Now there is no more concept of model exam. Now we have to call it a sessional examination. So one sessional examination will be for 30 marks. The other sessional examination which you conduct will be for 75 marks, but you have to bring it to 15 marks totally. Now you can see for the practical how they have given weightage. The weightage is again the same. For practical, for continuous assessment, you give a weightage of 10 marks, whereas for sessional practical examination, you give a weightage of 15 marks. Again, attendance is being considered. The assignments, we do have lots of assignment being given during the practical sessions. It can be your clinical presentation, drug presentation, case study, etc., etc. And you also have the clinical performance evaluation of your students done. Probably you have a rubric or a rating scale being followed in order to assess the clinical performance of the students. So you can see a mark of about 10 is being given for that. You also have the end of the examination evaluation. Ms. Abhirami, can you mute your mic, please? You have the OSCE, which is being conducted as the end of the posting OSCE. And every clinical requirement now, our Tamil Nadu Nursing Council has given us OSCE books. So the OSCE books also prescribe the competencies which the student has to achieve, and every clinical procedure has been described in detail. So you can evaluate your students based on the completion of these procedures, and you can give marks for them. So you can see that totally all this is being added. So you get about 30 marks, but this 30 is again converted to 10 to maintain the weightage of 10 marks for your continuous assessment. Moving on to the practical session, that's your sessional examination, practical. Again, as you're doing it now for the, Dr. MGR University, you always have the OSCE system, and then you have the conventional method of giving a patient to the student and conducting the examination. Well, this is what you're going to do, but you have a new terminology that has been propped up here. You call it as directly observed practical examination in the clinical setting. You call it as DOPS. DOPS stands for directly observed practical examination, which you're going to conduct in the clinical setting. Apart from that, you will also have OSCE. You can see that both these two together, you create a weightage of 15 marks for the practical examination. Now, you should understand there are certain courses that has been spread along 2 semesters. Like, for example, you have Nursing Foundation 1 and 2. You have Midwifery and Obstetrical Nursing, which is spread across 1 and 2 semesters. But there are certain courses which are just, confined to only 1 semester. Like your Adult Health Nursing, it is confined to 1 semester of 5th semester. You have 1 in the 4th semester, 1 in the 5th semester. Similarly, you have Community Health Nursing, which is placed 1 in 5th semester, the other one in 7th semester. But these are confined to 1 semester, and you have examinations being conducted in that particular semester. If that is so, you have to double the weightage of 20 marks for continuous assessment and 30 marks for sessional examination. The reason why I'm telling you is, like for Nursing Foundation, in Nursing Foundation 1 itself, you will conduct sessional exam and your continuous assessment, and you will give a weightage of 25 marks for the Nursing Foundation 1. Similarly, for Nursing Foundation 2, again, you will conduct CIA and the sessional examination. You will combine and you will get for 25 marks. So you add 25 plus 25, you will get 50 marks. Whereas here, when the course is confined to 1 semester, you will not have for 50 marks, you will get only for 25 marks. That is the reason we are doubling it for certain subjects, especially Adult Health Nursing 1 and 2 and Community Health Nursing. Moving on into the spread of marks across the various semesters, you can see there are some terminologies that is given. CIA stands for Continuous Internal Assessment for the theory and practical. And then you have the end semester exam, which either can be a college-based exam, so end semester college exam, or it can be end semester university exam, which is either a theory or a practical. So you can see in first semester, there are about 3 subjects. Now, there are 2 separate codes that are given for 2 subjects here. One is anatomy and physiology, but these 2 get combined as one paper in your semester 1. Similarly, you see a combination of subjects being cropped up in sociology and psychology also. You call it as applied psychology, applied sociology. So you have 2 course code given in the mark sheet, but you have 2 different subjects combined together. Now again, the pattern which you have to follow for the 75 marks which you give for university exam also varies. Now you can see this applied physiology and anatomy, equally it carries a weightage of 37 marks for anatomy, and physiology it's about 38 marks. And you also have a clear-cut directions given by Indian Nursing Council of what sort of question paper you're supposed to set. Number of MCQs that should be there in section A, which is applied anatomy, and number of questions that should be in section B, that is physiology. Similarly, you also have the pattern of exam that you are supposed to conduct in end semester college exam. So every end semester college exam should be conducted for 50 marks and it should be a 2 hours paper, whereas your university exam is going to be for 3 hours. Now you can see that the communicative English with the end semester exam, which will carry MCQs, essay, which will be 1 in number, and short answers and very short answers. So this is how you have to have your question paper pattern, which has to differ based on the type of course which you are selecting on. Now this is your second semester. You have similarly, you have different subjects that is placed and you give a weightage for each of the subject. And you can see that Nursing Foundation 1 and 2 is a practical examination you have. So we have a CIA of 50 marks, which includes what CIA you've got for first semester. The CIA for the second semester is cumulative added in order to get your CIA for practicals. Again, you can see that for your Nursing Foundation, you have a combination of exams being done, OSCE and the directly observed patient care, which you give. Moving on to the third semester. Now, third semester, you have again 1 adult health nursing and then 2 other subjects. You also find that there is a practical examination also being conducted here. So the similar system is being followed here. But in case of applied microbiology and infection control, again, you have a clarity here. Your applied microbiology is only for 37 marks, whereas your infection control, including safety, is going to be for 38 marks. And this infection control is purely on nursing concepts, which has to be taken by the nursing faculty. Now, in your fourth semester, you find that there is an elective that is there. You can find this elective should be conducted for 50 marks and it comes under your internal assessment. But again, it has to be sent to the university for appearing in the university mark sheet. Here again, you have 1 examination which is being conducted as a college conducted examination. And you apart from that, you also have pharmacology, a combination of 3 papers, 3 subjects are here, 3 courses are here. So you can see how the question paper varies now for pharma, patho, and genetics. You can see 38 marks for pharma, pathology it is 25 marks, and genetics it is 12 marks. So there is variation based on the number of combination of courses that we have. So here is your end semester college examination for professionalism and ethics. Moving on to your 5th semester, again, you have the community health nursing here. You have the education technology. Again, you have a college-based exam being conducted here, apart from the practical. So in your community, you're going to have 1 and 2, both will have practicals here as a university examination. So this is what has been discussed in the previous pattern. The pattern for 75 marks you see is a different here. The MCQs is going to be 12 in number, whereas essay, 2 essays will be there, short answers will be 5, and very short answers will be 4 in number. Now you move on into the 3rd year, 6th semester. Again, you have to identify 1 elective which has to be completed here in your 6th semester. Apart from that, here you have 2 main core subjects here, child health nursing and mental health nursing. And you also have the nursing management and leadership. So these are all important, as the student moves on to a higher semester, you find more subjects being added or more courses being added, and the student gets evaluated for higher levels. So this is the system of marks that has been carried out for your child health nursing and mental health nursing 1 and 2. Now in your 7th semester, again, you have two important major subjects that is coming up. One is your community health nursing 2. The other one is your midwifery and obstetrical gynecological nursing. You can see that gynecology has been added with obstetrics now. And apart from that, you also have a nursing research and statistics, which includes your project marks also. Now you can see an elective also should be completed here. So there is a tough, this semester is going to be more tough for the student as they are supposed to complete so many requirements during the 7th semester. So you can see again the difference of marks between the research statistics. You can see section A is research, which is going to be for 55 marks, whereas statistics will carry only 20 marks. Again, the spread of question paper, how you have to set your question paper is also very clearly delineated by Indian Nursing Council. Moving on to the 8th semester. Now, 8th semester, there is no theory paper as such. You have only your competency assessment, which should be your internal assessment. Now, when you assess the competency, it is mandated that you have to post your students in all the specialities, and in every specialty, you have to check the performance of the student, and each of the performance has to be calculated for 10 marks and then equated to 50 marks totally in all the 5 specialities. Now, apart from that continuous performance evaluation, you are also supposed to conduct an OSCE examination at the end of each specialty posting, and you have to derive for 50 marks. So these two put together will give the, end semester, you will get 100 marks, which will be your continuous internal assessment mark, which you will submit to the university. Now, apart from that, you will also conduct an end semester university exam. This examination, which you conduct in your 8th semester, is going to be an integrated OSCE system. So it's going to be an OSCE exam, which will have all the 5 specialties, the major specialties in nursing, and every station you're going to have, the stations which you have should be based on every specialty. So you have to include medical surgical, community, obstetrics, gynecology. You should have your mental health nursing and your child health nursing. All the 5 specialties should be represented in the integrated OSCE. Again, you need to have 5 examiners, 1 for each specialty, and out of that 5, 2 has to be external examiners and 3 have to be internal examiners. So this is something new which has been added in Indian Nursing Council syllabus from this coming up year. Again, this internal examination, in case you have a dearth of faculty members in your college, you can also include those people from the hospital, provided they have required qualification which satisfied their examination. Now, moving on to elective. Elective also, a pattern has been given for question paper sitting for elective. So there's going to be a test paper, you're going to give an assignment, and the skills and the attendance. So attendance will also be calculated. Now, this is a view of all the question paper patterns. I've just combined together, all together. You can see that there are totally about 5 question paper patterns that have come. So normally for 75 marks, you have a separate pattern, whereas a combined paper of 2 courses, you have a different pattern. Then for biochemistry and nutrition, the weightage differs 25 and 50, 25 for biochemistry and nutrition, it is 50. Pharma, patho and genetics, again, the pattern is different. And as I told you, it is different. So this is how the different spread of question papers occur. Now, I know that Dr. Sharda has detailed, in detail, she has given about the grade point. Ms. Jyotishwari, kindly mute your mic. Thank you. So here you can see that the most important point that you should consider is the student should be made aware that grace marks up to 5 marks only should be given to the students. So just sensitize your students that he will be eligible for 5 marks. Again, our Tamil Nadu Nurses and Midwives Council is going to take up a resolution on this. So provided this resolutions will be, submitted, and further what has been given will be circulated to all the universities. Again, what has been prescribed in the previous year syllabus, it stands still for the number of candidates we are supposed to have in the practical examination. We should not exceed more than 20 students per day. And it's mandated that the same set of examiners should be there for all the examination they conduct on different days for that particular course. And again, remember, communicative English and elective modules are not included in calculating the SGPS. And rank will be calculated only if in case the student completes the program within the stipulated period. So in case a student fails in a particular course, he will not be given the rank, but they will be, they'll be given a class, but no rank will be awarded. So let's be clear about that. So you will find the classification of rank as per the CGPA, as Dr. Sharda already pointed out. Now it's mandated that every student whom you are sending for university examination should have 80% of attendance separately in theory and practical. Then only he becomes eligible to appear in the university examination. But be very clear, this particular student has to complete 100% of attendance in the practical before the award of degree. So your course completion should be given only on completion of this 100% of attendance. Now for the end semester college examination, the minimum pass is only 50%, whereas for English it is 40 and for electives it is 40 also. Now there are lots of college-based examination. I know you all can remember what are all the college-based examination that we are supposed to conduct. Now, as I said, for English it is 40% and electives it is 40% is the minimum pass, whereas for all the other theory papers and practical it is 50%. And even in the mandatory module, a student has to score a minimum of 50%, which is considered as the pass mark. Now, all this will be added or included in the university examination, and the mark sheet which comes from the university will have the marks of all these examinations. Now, it's also mandated that this candidate has to pass both in theory and practical separately. And in case a particular student fails in theory, then he has to reappear both for theory and practical together. That's more important. Again, I would like to restate that the student should have cleared all the previous examination before he appears for the 5th semester and the 7th semester, which is considered where you have the break semester in the 4th and the 6th. So before he enters the 5th, yes, he should have cleared all the examinations. But however, be very clear, the student cannot go to the 8th semester until and unless he has cleared all the subjects in the 7th semester, then only he becomes eligible to take up his internship. Now, the other guidelines is he should complete his course within 8 years. And most important, no institution shall submit average internal marks of student not more than 75%. So all of us should have a clear-cut, transparent record that tells us that we are not giving more than 75% of marks for the average class. And again, non-nursing subjects can be taken up by the nursing teachers who have the right qualification to do so. And in case you have handled the non-nursing subject in which you have expertise, you can be the examiner for that subject. And all the practical examinations must be held in the clinical area. So these are, some of the guidelines that has been prescribed by the Indian Nursing Council. Again, you can see that you need to have an Excel sheet or a mark registry which has been maintained, which very clearly points out what is the marks you have given for attendance, the written assignments, the individual presentation. All the marks has to be tallied and you have to get the score for continuous assessment out of 10 marks. I'll just show you an Excel sheet here. I'll just show you an Excel sheet which tells you how to. Yeah, you can see the Excel sheet. This is normally a clear Excel sheet which will help you. Okay, how you can give scores for your students. So you have the name of the students. the attendance, what marks you give for the attendance, for the lab and the theory together, the number of assignments you give, 2 assignments has been given. You have a mandatory module. So all the mandatory module you total and give it for 10 marks. And you can see the assignment, everything has been tallied and it has been brought to 10 marks. And after that, you have a weightage of 10 marks for all the continuous assessment. Then you have your sessional exams, 2 sessional exams, one for 30 marks, another for 75 marks. But then you give the calculation or bring in for the weightage of 15 marks. Then you add the IA is calculated based on your continuous assessment and your sessional examination. So if you do it in this way, it will become very easy for you, more transparent way of maintaining systems in your college in order to give marks for the student. And this will also it will be very useful for you to track the students' record of how many they have completed, what they are yet to complete, and what is the marks they have gathered or gained in each of the areas. So this is a simple system which you can follow. So always, any change is always having some chaos. We have to understand that. But then after lots of commotion, confusions and chaos, you will definitely have a clarity of path, how to go about. It definitely takes some time for all of this to adjust and get accommodated to the different question papers and different assignments, the continuous internal assessment and the sessional examination. But then as we progress and as we work out with our students and other teachers, we will have more confidence in going about with a system. So happy examining to each and every faculty who's there. Thank you. So if you have any further questions or any other suggestions or clarifications, do put it in the chat box so that our experts are there to further discuss on that. So I think Dr. Sushila is there. With this, I complete my session on formative summative evaluation. If Madam Sushila is there, we can move on to the next session. Sushila ma'am, are you there? Sushila ma'am there? I'll just check out with Sushila. If you can just let in Dr. Sushila to join the forum, Technical Committee of Tamil Nadu Nursing Council, just let in Dr. Sushila to join the forum, please. Anyway, meanwhile, let me take up so many questions that are there in the chat box related to this one. Okay, somebody has asked me, is LMS in assignment has to be established by own institution or by the university? It's up to your university. LMS is something which we follow in our university. So I just made it for, our university. So if you don't have, you can give a assignment, which is more, documented assignment, which students submit in your paper. So it is based on the system you have in your college or university. If you have, you can follow. If you don't have, whatever you have and feasible for you, you can utilize that. I hope I have answered the question. By Prashanti. LMS actually, somebody has asked, Anita M has asked, what is that LMS in that assignment? LMS stands for Learning Management System. We use this learning management system, which is more of a blended learning system, which adds the student can work from home and he submits his assignment. He can do a quiz online. And as teacher, I can log in and I can check and be in touch with him. I can see how many minutes he has taken to complete the quiz, what time he has logged in, and what is the marks. Everything can be visualized in the LMS system. And we can also post certain additional materials, what you want to learn. The student has to take up for self-study. Okay, you can post it in this learning management system. So these are advanced technologies which you can utilize in your area. Madam, can we start your session?
Yeah, I'm sorry.
For the inconvenience, delegates, we had some glitches with Madam joining in.
Yeah, okay. Okay, thank you, Punita. Okay, bye.
Yeah, now we will move on into the next session. This session is very important again. It's more on the implementation aspects related to the curriculum. Dr. Sushila, principal from Bill Roth College of Nursing, is here. Now she is going to tell us about the implementation plan for theory and practicum. And she's going to tell us how to, actually design a master plan, what points has to be considered, and also how to, prepare an academic calendar. Now, these are two, the academic calendar is in fact a new component that our Tamil Nadu Nurses and Midwives Council wants all the colleges to follow. And I hope Madam will throw light on two important components for us to implement very smoothly in our colleges. Madam, over to you, Madam. Thank you.
Thank you, Nalini. Thank you. Actually, my session was put on 3:40, so I came in at 3 and waited for this. That's why the delay has happened. Sorry for the delay and some technical issues happened. And good evening to all the people who are here. All the delegates, principals and vice principals have attended already, and all the teachers who are very important actually, who are the pillars for the any college, who can support the principal to implement the curriculum. So today my topic has been given as Nalini explained. It is on the, I'm just sharing my screen. Just tell me whether it is coming. As my screen is shared already, you are able to see my screen, audience? Are you able to see my screen?
Yes, ma'am.
Yes, okay.
Yes, ma'am. Curriculum implementation plan.
Yeah, implementation plan for theory and practicum. This is our topic given by Dr. Annie Grace Kalaimadi, registrar, and the whole team is working up. Dr. Nalini and Sharda. I think from morning you might have heard about all three of them. So thanks for all the coordinators taking up this and the Tamil Nadu Nurses and Midwives
Sushila
Council
ma'am,
for.
sorry to
Yeah.
intervene. I think you need to just put on only that PowerPoint. We can see all other files also. So if
No,
you
no, I have put only my PowerPoint. Only my PowerPoint is there now.
No, ma'am. I can.
Something
I'm
else is
able
there.
to
I can see
visualize.
only PowerPoint.
No,
1
ma'am.
minute.
Just
1 minute.
go out.
1 minute.
Stop
Yeah,
sharing.
1 minute. Yeah, 1 minute.
Once again, go to share now. Yeah.
Now it's okay.
Yeah, just open the PowerPoint alone and then you share, madam.
1 minute. I opened only PowerPoint.
It's okay, ma'am. Sometimes it happens like that.
Yeah. Just see that now. Is it only PowerPoint is there? 1 minute. 1 minute. 1 minute. 1 minute. I'm just sharing the screen again. 1 minute. One minute. Yeah, it's sharing now. Are you able to see my screen now?
Yeah, we are able to visualize in the same mode, madam. Madam, you want me to share the screen for you? If it's okay for you?
Why? What is happening? Yeah, I don't know what is happening. Actually, I'm sharing. I don't know why it's like that. I'm so sorry for that.
It's okay. It's okay. Do you want me to share that for you?
Yeah, 1 minute. Yeah. Okay, maybe you can share if everything is coming again. Now you are able to see the no, not able, no.
So we are able to see.
Then you can share. Yeah.
We are able to see. Only problem is we are able to see, some other files also additional to the PowerPoint.
Okay.
It's a two view.
Is it
comes
now?
up in a
What
two
has happened now? Is it okay now or no?
No, madam. It's the same.
Okay, now I will stop sharing. Nalini, you can share, no problem. Okay?
Okay.
I'll stop share now. Yes.
Sure, ma'am. Sure.
Okay. Yes, okay, no problem. I stopped share already.
Yeah, I'm opening, ma'am. I'm opening your PowerPoint.
Yes, Nalini, please open, no problem. இல்ல நான் இப்ப ஸ்டாப் பண்ணிட்டேன். I stopped sharing. Nalini will open for me. Dr. Nalini will open. No problem.
Is this your PowerPoint or Dr. Kanchana's presentation? Should I open?
Anything. Kanchana's also you can open. It is the same, only some modifications.
Yeah.
You can open anything, no
yours.
problem. Yeah, open the anyone, whatever you have, you just open. I'll present it. That's not an issue. Okay, I think this is mine you have opened. Okay, no problem. So this is about, okay. So all the introduction as you can put it in a view. Yeah, slideshow. Okay. So the objective of this session is actually developing a master plan for first to 8 semesters and develop an academic calendar. This was told by Dr. Nalini too. And now the next slide, Nalini. Yeah, this is a template for first semester. Actually, you all might have know what is how much of theory hours for every subject and how much of practical and everything you might have heard already from the morning. What is credit hour and how many theory hours is equal to how many credits. All that you might have learned already. So this is just a template that how this is what we are going to implement, like the orientation session. I mean, this is for first semester. I have just made a template about the weeks. Actually, we are starting in Tamil Nadu Dr. MGR University from October 1st week. So we have planned in a weeks. The 26 weeks we are dividing, in which we wanted to have 100 working days. The first sem we have a theory about 480 hours, which plus we are having a simulation learning of 80 hours and study of 40 hours plus co-curricular 40 hours, total of 560 hours and clinical 160 hours. So total of 720 hours we supposed to put it in a master plan. So in this you would like to add orientation. Somebody can mute your mic.
Ms. Jagadambal from Sri Shastra College.
Yeah, please mute your mic.
Thank you.
Yeah, please mute your mic. Thank you so much. So in the template of first semester, what we have planned already is the orientation part is to be given for 1 week, that is for 35 hours. So in orientation, what we would like to tell all the people is please, not only your college and whatever the activities and what courses in nursing, that will be for some time, but you please orient the nursing students to motivate regarding the personality training. So many, like motivational strategies you can implement and include in this orientation program too. That helped us long for the students, because we have done study also. Some personality training and motivational strategies in the orientation week will help the nursing students to take the nursing course in better way. So the 1 week is planned for that. Then theory block, then clinical block is full block is planned here, but you can plan even the partial blocks. And we are giving revision 1 week and preparatory and exam holidays for 2 weeks. Then vacation is 3 weeks. How we have put it in a template, real template you can show here. You can see here the next slide. Next slide, Nalini. Next slide. Can you change the slide? Yeah, okay. So this is the real plan that we have made. So this is about the weeks have been planned, and also the Saturday, the Sunday to Saturday and working days and total hours per week, and how many holidays been planned in the last column, and in which, as I told you, the induction is for 1 week. We have planned for 35 hours. Then the full theory block we have planned, in which the theory block we are planning the skill lab and co-curricular and self-study, everything has been planned. And we have to have a 2 sessional exams. All 2 has to be completed here, 1 and 2, because this is purely on theory. They might have told you already, sessional exam 1 and 2 has to be completed for the theory assessment, and for the clinical there is a continuous assessment, and also we have a comprehensive assessment. That will be continuous assessment, all will be planned in the practical block. So that is separately there. And vacation is overall 3 weeks, that you can plan for December 2 weeks, and 1 week you can plan at the end also, because as the council wants to bring the uniformity, what they have told us, you can plan 2 weeks of vacation. The December, May and January, the inspections, nothing will happen to the institution. So you can plan your vacation accordingly. And as such, overall 3 weeks of vacation you have to give it in the each semester. So uniformly December you can plan for a vacation, and 1 week you can keep it for your end of after the university exam of first semester, you can plan it. That is also possible. And a full day practical block has been planned here, but you can plan even partial block, because our register madam has told that the government hospitals can send their students, then accommodate their students of nursing students, our college. You can plan in a rotation basis, morning shift, evening shift and night shift can be planned according to the principal and the hospital directors. They can sit and plan with them, and limited students can be sent to one hospital at one time. So morning duty, half of the colleges can send, and evening duty and night duty. So all students can be accommodated in the hospitals. So that plan can be put it in as a partial block, but some colleges will have a long distance from the hospital. You can plan only a full day block. That is all optional. That can be modified in the main plan. But in the practical block, you plan please field visits. That is also to be included in that ask. And there is a modules you might have learned from morning, what are all the elective modules and mandatory modules. Here the mandatory module of first aid module, where to complete, what is the deadline, that also can be planned in the master plan, so that we will not forget, and students also will remember that first aid module has to be completed within this period. So the practical block, end of the practical block or before the 1 week end of the practical block, you can put a completion of the module that can be planned. And here I have put sessional exam too, but that can be put it in a theory block itself. And you can have a revision and model exams and practical continuous assessments, all can be planned in that where I have put sessional exam too. That block can be kept for all your model practical exams. Then your revision and exam and preparatory holidays comes. Then last also you can go for your, so the last usually we put it as exam and preparatory holidays and exam, where which I have put 3 weeks of vacation can be split, 1 week can be given in the last. That is all your institutional adjustments that can be given, no problem. But as long as 3 weeks of vacation is given, that's so fine for us. And this is our the new things to be added in this master plans or credit hours that you have to put it. Already you know how many of theory hours is equivalent to 1 credit. 20 hours of theory is equal to 1 credit. And you know that 40 hours of this simulation is added into 1 credit hour. So these, according to the credit hours which is INC has prescribed, you can give the credit hours. Prescribed hours we are already done. 10% extra can be planned. I think somebody is talking. Please mute your mic so that my voice will be clear. And the credit hours also you put it in the master plan, which help the students to understand exactly what is the credit hours that is being planned for each subject. Though you plan extra hours like 10 to 15% extra hours in theory and practical, credit hours will not be added. It will be the same. So the total credits for the first semester is 24 credits. Though we planned 760 hours of planned hours against the 720 hours of stipulated, the total credit hours will be remain same. So the new things to be added in the master plan, what we are saying is only about put a field visit, put your sessional exams 1 and 2, put your model exams and add credit hours. When you add a credit hours, you add it, highlight in the master plan for skill lab how much and what is your planned hours and what is the credit hour for skill lab, what is the credit hour for theory and what is the credit hours for practical. So if you highlight like this, how we have given a model, I think that will help the students to visualize, because you are going to hang the master plan in the classroom. Your master plan and clinical rotations will be in the classroom. This will definitely increase the vicinity for the students, and also they will understand that what they are learning against how much of credit hours. So instead of going back and seeing, this is all been there, and this master plan will guide us what to be implemented for each day or each week. And you can see that each week how many hours we have completed and whether it is right, are we going in the right track, all that this blueprint will definitely guide you. The next slide, Nalini, next slide please. Yeah, this is for the second sem. So same thing what we were saying again. 26 weeks will be planned with 3 weeks of vacation, 1 week of exam and preparatory holidays will be 2, and revision. All that's here in this second semester. We are having actually theory of 320 hours plus skill lab of 120 plus 40 and 40 plus 20, and clinical hours been increased from 120 hours. The total is 800 hours. The first time the total was 720 hours, then all will be, because that induction we have taken some hours. So total is 800 hours, where 480 is theory and 320 is practical. That we have planned, we have put a again the sample master plan has been prepared for you, which I will show you. The next slide, Nalini, next slide. So the same thing, if you see, the second sem, we are not having the induction training, but we are having a full theory block and full clinical block, and sessional exam 1 and 2 has been planned here. Field visits are there. Vacation 3 weeks again I have put together, because May month we are planning to have a vacation. You can reduce to 2 weeks or you can expand to 4 weeks. It's just up to you to have a 6 weeks of vacation in a year. But plan this May and December as a vacation for you as a standard from the council. And you can reduce 1 week, that can be given again in the end, or you can expand 1 week, that can be reduced from the other short-term holiday week or vacation month. So that is all up to the institutional, or because the deemed universities will have a different thing and MGR University will have a different streamline. So but as long as you are giving 3 weeks vacation in 1 semester, for us it is fine. Same way, if you complete your field visit, whatever is there to be done within the clinical block, that is what we expect. And completion of assessment module, that is health assessment module, which is to be completed in the second sem. So we have given a deadline in the practical block. Always plan your completion of module is to be done before the end of the practical block. So that if you plan like that, I think that will be okay. Then the clinical exam, practical exam and continuous assessment of competency will be done in the end of the practical block. Then you can give a self-study or revision holidays. and exam preparatory holidays at the end. The same thing has been planned here also. Your credit, a total of 295 hours of theory plus simulation learning here 140, and self-study is 42, co-curricular activities 20. So totally 497 hours, and practical 329 hours, 320. So 9 hours only we could able to plan extra, and revision and study holidays was 42 hours, and exam and vacation 3 weeks. Total working days is 129 days comes, which equals to 903 hours. So this is actually a rough plan, but this is, we are just giving a guideline, and we will finalize it, and we are going to put it in the council website, which will be applicable for all the colleges which is coming under Tamil Nadu Dr. MGR Medical University plus deemed university. They will have some variations in between of start of the semester and end of the semester, but the coriander, whatever with which we are going to put input will be the same for everyone. And we are having a credit hours here again planned each subject against the theory as well as the skill lab and the practical. So total of stipulated hours here is 800 hours and credit is 21. So planned is 826, though the 26 hours is extra. As I told you, credit hours will remain the same. So this is what is the template for the master plan of second semester, and all other semesters we are just given the master plan template for you to prepare the semester plan. You can roughly just go through the templates. I'm not going to explain to you. This is for the 3rd, 4th, 5th, and you can just run through 6th and 7th. These are all the things we have given, but you can plan it accordingly. The last slide will be discussion. So as I told you, partial block you can plan. Credits you can will be the remaining the same, will not give extra. And vacation, as I told you, you can have either 2 weeks here at the end 1 week, or 4 weeks and reduce 2 weeks there. That is up to you. And timing of clinical postings, as I told you, because everybody cannot go to the one hospital at one time, you can plan in 3 shifts or 4 shifts. 3 shifts will be ideal, morning, evening and night. So discuss with the district coordinators has been allotted already by the madam. So please discuss with them, have the timings, and go to the clinical posting in the particular timings. That's what we request you to go through that. So this is what is the basic guidelines for the implementation of the master plan or preparation of the master plan and how to implement. So just small lights I have given. And next one, I would like to show the academic calendar also for you to go through. Nalini, you have the Word format of academic calendar with you. Nalini? So wait, I will just try my...
Ma'am, I will just open, ma'am. I'm just opening, ma'am.
Okay, Nalini, because I thought maybe... So the academic calendar, that it's like all the universities will be giving for the student, for them to carry with them. They know that each day, each week, every day, what is going to happen for them and what are all the activities has been planned. This will be prepared. Basically, one common format is going to be prepared and we are going to hand over to the university. And the council also will release the common format, and which we are going to give it to the Tamil Nadu Dr. MGR Medical University also through the council. And they are trying to give it to the institutions. You can always give it in a e-format to the students to follow it. So that will be applicable, or even MGR University will publish through website that can be given. Additionally, if any institute wants to add that, you can separately give it to the students, but not below than that. And don't go away from the principles that what is to be followed in the academic calendar. So the academic calendar is just all the activities. I think Nalini will be opening soon.
Yes, ma'am.
Yeah, so this is actually in the Word format, because earlier it was like, it was no vicinity. So this will tell you what is to be done. So October 1st, most probably we'll be starting our academic year this year, 22-23. So like this, first will be Saturday, second is Gandhi Jayanti, then orientation program will have for 1 week, and completion of orientation on Friday. So student will know Friday till Friday I have an orientation. Then Sunday is going to be holiday. From Monday all will be theory block, and you see sessional exam 1 commences. That will be in the month of 1 minute, little above. So this is the which day? November. So the November 7th, they know that the exam is going to come. It's not that we are just going to give a timetable or we are just going to announce it. They know that when they start the course only, they know the sessional exam 1 will start on November 7th. So in case if there is any change 1 or 2 days due to any unavoidable circumstances, we are going to inform. Otherwise, they know when the exam starts, when it ends. Then holiday, the next. You can move little forward. Yeah. So like this, December, what is there? Every month, what are all the important things will be planned in the academic calendar, and this will be given to the students. Even the clinic, Christmas and New Year vacation. So this is like that. If you just go through, it will be shown everything. So just go down. Yeah, college reopens up. So they know you don't need to announce. See, every time students will come and ask us when I can book the ticket, what I can do. So here it's very clear. Monday is the college reopens after vacation. So they know when the vacation starts and all that. So the Pongal, holidays and everything. So everything has been planned. See, tentative university end semester examination commencement. So they know that it's 20th, this Monday, the exam is going to commence. So they are ready with that. We don't need to announce unless there is a change. We don't need to tell anything for them. They know when they carry the academic calendar, they will be thorough of what is going to be in the next. So this will definitely, keep the students awake. What is next? They know everything. Then the April, the semester vacation will start. Then the holiday, Good Friday. After that, the college reopens on April 10th for the next semester. So this is how the students will have all the each day planned in each week, every month, all that. So students will be ready to take an action accordingly, when to study, when to break, all that they know. So this academic calendar will be very common. Through council, it will be submitted to the university and all the deemed universities and our city. I think the students all will have a uniformity in their academic activities and other activities. The overall, you can see the 1 year has been made like this, and this will be helping the students. This is for academic calendar for 22 to 23. I think 23, 24 later we can prepare. So this is the sample of academic calendar. The whole year has been explained. August 15th, Independence Day. So like this, if you put everything here, actually the second Saturday, Sunday, they have planned as a holiday, I think, but it's up to you and the university examination. And when we go to the IMH posting and all, we cannot plan for second Saturday as a holiday. So that those things the institution can say, make some modifications. There is no harm in that. So that you can plan. Okay, so this is about the academic calendar. I think the master plan and academic calendar will have a same basic principles and some uniformity in implementation. That will help all college students will have the vision towards how the academic activities are going to be carried out in basic BSc nursing. So that is what is my vision also, and madam, our registrar vision also, that all students will have a uniformity in implementation and learning. So this is my request to all the teachers to understand the academic calendar, how it is working out. This is very simple. And also all teachers, you know, that template of master plan, you have seen that. Start preparing for other semesters, but for these 2 semesters, try to implement it as per the guidelines we have given. What are the problems we face, we will discuss, and we will try to do modifications for the future implementation. So thank you for listening this particular session of mine about the implementation of the curriculum. So thank you so much, Dr. Nalini, and thank you so much for all the other coordinators, Dr. Sharda Ramesh and Dr. Kandasamy, and also Tamil Nadu Nurses and Midwives Council team and our Madam Registrar. Thank you so much to all the participants. I think this is the last session. I think we are in time to complete, and next session will be on discussion of other things, right? Thanks, Dr. Nalini. Thank you so much.
Thank you, ma'am.
Thank you for opening this place. Thank you.
Thank you for joining and giving your expertise on the implementation aspects, especially the master plan and the academic calendar. And I hope all of us will now get our competency to develop an academic calendar in the right way and give it to our students. Your post test is already pasted in the chat box, and the feedback is also pasted there. Attend both the post test and the feedback. Remember, to give your RN RM number in the feedback form in the slot that has been assigned for it. Once you have completed, thank you from all of us over here on the first day of the virtual workshop of BSc Nursing Revised Syllabus Curriculum Implementation organized by Tamil Nadu Nurses and Midwives Council. I thank you all on behalf of Tamil Nadu Council for joining us for the day. Thank you. Once you complete, please leave the chat workshop, please.
Nalini, can we leave?
Thank you,
ma'am, please,
Nalini,
please.
and
Thank
thank
you,
you,
madam.
Dr.
Thank
Shanda
you.
and Dr.
Thank you,
Kandasamy
all
and
of you.
all the
Bye.
colleagues.
Thank you.
ma'am.
Thank you
Thank you,
so
Nalini ma'am.
much.
Thank you,
Thank
Sheila
you.
ma'am.
you.
Thank you,
Bye.
Shanda
Yeah,
Bye.
yeah, yeah.
Bye.
Thank you.
If
Thank
anyone
you.
has
Thank you,
a
Bye-bye.
Fabiola
problem
ma'am.
with
Bye.
feedback form or post test, please let me know. Put up in the chat box so that I'll be able to personally help you.
Okay, Nalini. Bye, Nalini. Thank
Bye,
you so
ma'am. Thank you
much.
so much.
Yeah.
Shall we end the session, ma'am?
Sir, 2 minutes, sir. Let them
Oh.
finish up this post test
Okay.
and feedback.
Okay.
Yeah, I'm
Should we-
posting it once again.
Ma'am, we'll give 10 minutes, ma'am.
Yeah, please, sir. I've just posted once again for the benefit of others, the feedback link and the post test link. If you have completed, you can leave the session so that we will know how many of them are still, supposed to complete. If you have completed, please do leave the session. Thank you all. I really thank the technical coordinators for this workshop, the support staff from Tamil Nadu Nurses and Midwives Council, Mrs. Punita and her technical team for organizing this, being with us throughout the day and organizing this workshop. Thank you. I think almost I can see 213 still in there. The virtual recording of this video will be available in the website of Tamil Nadu Nurses and Midwives Council, so don't worry. If you've completed, please leave.